7 cases of COVID-19 across this country, and that number is changing by the hour. All day, provincial governments have been announcing new measures to try to combat the outbreak, many aimed at ensuring greater social distancing, keeping people away from each other. I know many of you have been doing that at home. Right now, though, we are waiting to hear from the Prime Minister on the latest moves to try to contain the pandemic. This is the place where we were back on Friday again, a live shot outside of the Prime Minister's residence, Rideau Cottage. Moments from now, he will emerge from his home to address the country and provide an update on measures. You'll remember that the Prime Minister is himself in self-isolation for a period of 2 weeks after his wife, Sophie Gregoire Trudeau, tested positive for COVID-19 last week. We'll carry his remarks for you live as soon as he appears, and after the Prime Minister speaks, he will take a few questions, but we should tell you as well that federal ministers and public health officials will hold a news conference at a separate location. We will also bring that to you live. Of course, very important these days to get all the latest information and stay up to date with how it may impact your life. The host of Power and Politics, Vashi Kapelis, joins us again, as she did on Friday, and she's been on top of this story through the weekend as well. Vashi, what might we expect? I know the weekend was, if you were out and about, which many people were not, but if you were on social media, there were lots of questions from people either returning back into this country or still considering leaving the country about what they should do and what measures the government was taking upon their return.
Yeah, very much so. And especially, I think, because that message went out Friday, don't go outside of Canada, don't travel. And if you are coming back, you need to self-isolate. The questions that we were particularly seeing from Canadians over the weekend was, why isn't this information being disseminated to travelers who are arriving back? We've seen some of the scenes at various airports. We know that there were long lines at customs, for example. Why were they only being asked if they'd been to Italy and Iran? Why weren't more questions being added to that and more instructions being given? So I would expect that there will be a lot of questions for the Prime Minister and various cabinet ministers where that is concerned. I think as for what to watch for, we've been hearing now for a number of days from the Prime Minister and those cabinet ministers that, quote, everything is on the table, right? All options are on the table. I think Canadians are eager to know which of those options the government has selected and specifically how they will be implemented. So when they say on Friday, for example, that international flights will be restricted to fewer airports, we know now that those airports, for example, will include Toronto, Vancouver, Montreal, and Calgary. Specifically, which flights and during which times? When does that start? How will it be implemented? I think that there are a lot of sort of follow-up questions, if you will, to the kinds of things that we've heard so far from the government. I think Canadians are looking for specifics, and if they don't get them, there will be some big questions for the Prime Minister.
And it's worth pointing out, because my producer is good at finding this kind of information, that more than 90% of international passengers already pass through those 4 airports that you mentioned there. So
exactly.
If you're funneling travelers into certain areas, but they're already getting most of them, what change does that really make concretely on the ground? The changes that have happened over the course of the weekend, certainly we've seen more provinces moving to close schools. We've seen provinces like Quebec, for instance, moving to limit any kind of social interactions. Not going so far as to shut down restaurants, but asking them to work at sort of a medium capacity, but telling people to stay away from bars and clubs. We saw Dr. Tam yesterday tell Canadians that the window to, quote, flatten the curve is narrow. And again, Canada's Chief Public Health Officer yesterday, Vashi, saying that the government had moved from telling people to self-monitor when they return from trips to now self-isolate. And we did start to see that information pop up today at airports.
Yeah, we're just definitely starting to see that come up. And we saw the CBSA, for example, announce that it would be implementing new measures. There's like a pamphlet that they're giving out. I think the sort of gaps right now, and certainly what we're seeing on behalf of some of the provinces, I know for a fact that a number of premiers have raised this with the federal government over the weekend. They've sent some of their own resources to the airports to try and make sure that message gets across. Now, they're worried that it's not, basically. And I think that's those are the kinds of questions certainly that the Prime Minister will be getting today. If in fact those are the instructions, what are you doing to ensure that they get across to people? And what are you going to do about the people who didn't receive that message? What is the plan where they are concerned? Because we've seen, through the magic of TV and social media, just how many passengers were returning. We know that since the message came out over the weekend from Foreign Affairs Minister François-Philippe Champagne, that if you're abroad, you should come back. People have heeded that instruction. And so as a result, what has or hasn't happened? I know from especially talking to people in Ontario Premier Doug Ford's office that there is a ton of concern from the Ontario government around that. There's also, and this is a kind of question looking forward, a lot of concern about the border with the U.S. Clearly, that border is so vital to our economy, to the distribution of goods in this country. But most of the cases that are the newer cases in Ontario are people who have either traveled to the U.S. or coming from the U.S. And so there was a lot of concern about that border as well.
Okay, and so just so people know, if you're arriving at the airport, if you have arrived there, say over the past 12 hours or so, when you go to fill out the form, the touchscreen where you have to say where you've been, they're not only asking you now where you've been, they're asking you if you are exhibiting any symptoms, and they're also asking on that same page that you acknowledge that you are being asked to self-isolate for the next 14 days, and then you have to tap acknowledge. So that's the sort of the concrete, practical things you will see if you're returning from a different country and coming into airports right now. All of this, though, as the rest of the world starts to lock down some of its borders. The U.S. was, of course, had already said it was going to lock down European countries. It has now added the United Kingdom and Ireland to that ban as of midnight tonight. The EU today said it will ban non-essential incoming foreign travel into the EU for a period of 30 days. And the UK's Boris Johnson is telling people to stop all unnecessary contact and stop travel. David Cochrane joins me here in Ottawa as well as we look at the Prime Minister's official residence there, Rideau Cottage, waiting for him to come out and update us. David, what are you hearing about whether Canada might follow some of those other international examples we're hearing now?
Makes this announcement today. I've confirmed that from multiple high-level government sources. They will not share the specifics, but I'm told it will go beyond the 30-day restriction on essential-only travel that we saw at the European Union. There is this effort to, as you and Vashi outlined, to funnel the flights to those 4 big airports. But I think there's also a requirement, this is the sense I'm getting from speaking with people inside government, to reduce exactly the number of people who are on those flights and exactly where they're coming from. So with the World Health Organization, for example, saying last week that Europe is the new epicenter, I suspect you will see some restrictions that target people who have traveled through Europe or coming from Europe. We're not looking at an overall grounding of flights. I want to stress that because the government is asking Canadians to come home, and they are urging the airlines to keep flying so that Canadians can get back to the safety of their own homes inside their own country. But there is a growing sense at the cabinet table, we're being told, of sweeping measures to restrict the flow of travel in and out of the country, building on the announcement on Friday from the federal government urging all Canadians to not leave the country and those who are abroad to come back as quickly as possible. The big challenge that will, as I understand it, will not be part of this announcement, but is something the government is going to have to confront in the coming days, is what to do with the Canada-U.S. border. You do have public health officials saying that an increasing number of new cases are people who are returning from holidays and travel to the United States. This is why schools were closed in the run-up to March break in places like Ontario and in Quebec because of the expected flood of travelers returning from south of the border. But what do you do about a problem like the U.S. when your economies and your supply chains and your food and medical supplies and medical equipment are so completely intertwined and reliant on each other? So I would expect these measures today to deal with overseas international travel and continued work and monitoring on what to do about the Canada-U.S. border. We did hear from Doug Ford today, the Premier of Ontario, saying he would support closing the border to travelers, but leaving it open to commerce to keep the economy and the supply chains going. That's certainly, when the Premier of the biggest province in the country is pushing for that, that's something the government has to take seriously.
Okay. And of course, we are also waiting this week to hear more on the fiscal stimulus package that the Finance Minister promised was coming on Friday, as he and the Governor of the Bank of Canada moved to make sure that there was enough liquidity and room inside our financial system to make sure that we were all going to be solvent for a while. But we are also expecting more specific measures for Canadians to be announced sometime this week. Ontario did a little bit of that today, making sure that people who have to take time off work will be compensated. Let me bring in Dr. Michael Gardam. He is the Chief of Staff at Humber River Hospital in Toronto. Dr. Gardam, it seems to me that we went from saying we shouldn't close borders. Even on Friday, the Health Minister, Patty Hajdu, is saying viruses cross borders. Viruses don't understand borders. Why are we now seeing the EU, certainly the UK, saying to stop travel, and potentially even Canada now trying to limit travelers? How important is that measure from a public health perspective?
Well, I mean, it's one of the public health measures. It isn't the only one. And so you're right. I mean, our borders are really quite porous, and you certainly can't shut our borders entirely. But I think the notion of, we have a fair number of travelers, presumably hundreds of thousands of people who travel around the world any given month, especially to the U.S. during the wintertime. So having those people move around airports, move around airplanes, et cetera, stopping that is yet another social distancing measure. That falls in the same category as the closing the schools and the universities and potentially businesses, et cetera. So this is really sort of the full court press approach of trying to limit people's exposure with others in every possible circumstance.
And just if people are tuning in now, we're bringing you the CBC News Live special as we wait for the Prime Minister to again address Canadians today about more measures that his government is taking to try and contain the coronavirus. We are looking at a shot of his front door where he is self-isolating with his wife and his 3 kids, and he'll come out and speak to us momentarily. Dr. Gardam, while I have you here, we heard Dr. Tam, the Chief Public Health Officer, yesterday talking about how the window to flatten the curve is narrow. It's closing. And that's why they are telling people to self-isolate, and measures seem to be, squeezing in on us. Do you agree with that assessment that we are almost out of time in terms of flattening that curve, or just give me your assessment of where you think we are?
Yeah, no, I mean, whenever we bring these in, we will flatten the curve. It's just that if we bring them in too late, we'll have a very, very big curve to flatten, right? And so the idea is you want to do these things early. And you need to be, I would argue, you need to do them before you even think you need to do them in a way, because we have had likely local transmission going on here in Canada for, I would say, at least a few weeks. And so every 3 to 4 days, the number of cases is doubling, and it doesn't take long to get overwhelmed with cases. I mean, where we look today, we're going to look very different a week from now. And so bringing in these control measures as soon as we can is a very good idea.
Okay, Dr. Gardam, I'll keep you on standby there in case we need to come back to you. So good to always get your advice, because you certainly know more about this stuff than I do. Thank you very much. Global affairs, as we've been talking about, asking Canadians who are out of the country to get back. And the reason there is there's a lot of concern inside government that commercial flights are going to start to be very limited. We're certainly seeing airlines cutting back on their flights or even not going into some countries. And the government has, as of yesterday, made it quite clear that it simply cannot go around the world saving Canadians from different locations. So they are telling people to get back and get back quickly. The CBC's Megan Fitzpatrick joins us now live from Toronto's Pearson Airport. Megan, what are people telling you about the screening there today? Because it has changed over the past 12 hours or so.
Yeah, and you can physically see that, Rosemary, because that door behind me, when the passengers come out, I can see them with pieces of paper in their hands that have been produced by the Public Health Agency of Canada, and these are being given to passengers by the customs agent on the other side of that wall. So these handouts seem to be given to all passengers now. That is new. Over the weekend, we were hearing about people coming back here to Pearson who felt like they weren't being thoroughly screened, but the CBSA now says there are enhanced measures in place, including those handouts that are being given out, including added signage. They say they have increased the number of CBSA officers on duty. They also have now changed those kiosks that passengers have to use as part of the customs process. I think we have some graphics of those, Rosie, that show that people now, all travelers are asked if they have any symptoms, fever, cough. The next screen asks them to click that they are acknowledging that they are being asked to self-isolate for 14 days. And some of the passengers I've talked to here today do say that they were advised that by customs, and that they do intend to do that. And people are telling me too that they were asked where they were coming from, what countries they were coming from, and if they have any symptoms. So it does seem like the measures have been stepped up on the customs side. Here at Pearson, I can tell you too, the airport saying that it's working closely with the Public Health Agency of Canada, with CBSA, to ensure that passengers, they say, are safely screened and efficiently screened. One thing Pearson does tell me is that it's possible some planes might be kept on the tarmac for a bit longer to ensure that passengers are moving through the customs area. They don't want a backlog of people in there, so it's possible that people are kept on the tarmac for a little bit longer. I've asked for any updates today, this afternoon, if that has happened today. We know that happened yesterday here, Rosie. But right now, as you can see, it's pretty quiet at the airport. Passengers have been sort of coming in waves, trickling out as different flights arrive. Right now, though, at the arrivals terminal at Pearson, pretty quiet here right now.
Okay, Megan Fitzpatrick out at Pearson Airport, where it's not just people returning from spring break, lots of snowbirds too making their way back into this country because the weather has turned nicer, and they too will have to be very careful upon return, given that some of them in fact may be a little bit older and more susceptible to getting the virus. Vashi Kapellas joins us again now from her studio. You can't see her, and that's because we're still watching for the Prime Minister, but we believe you're there, Vashi.
I sure am, yes.
So I think that there was just a G7 leaders statement that was
I'm just
put
looking
out.
through that now.
Yeah,
as well.
so they were supposed to speak this morning. We found that out on Friday as an attempt to try and get some coordinated global action. I would imagine not just from a public health perspective, but an economic perspective. There's a lot of concern that what we are seeing now, I mean, we're seeing airlines shutting down or reducing capacity. If you just walk outside, I'm sure everybody has had the experience of seeing empty restaurants and empty, maybe not grocery stores, but other stores. And eventually that is going to start spiraling into other problems. And a recession is, most banks in this country say, basically inevitable.
Yeah, most economists by Friday were saying that even in the Canadian context, of course, it is inevitable. I'm just looking through that G7 leader statement, and we saw the sort of beginnings of some coordinated action yesterday when the Fed again slashed rates in the United States on a Sunday, I should say, and noted in its announcement that that was coordinated action with other central banks across the globe, and cited Canada actually first in that list. We saw on Friday the rate cut here with the central bank, as well as a promise from Bill Morneau to inject significant, was the exact word that he used. That's how he characterized the stimulus that they'll be announcing. My information is they could announce it as early as tomorrow morning. The readout from the G7 leaders says we're committed to marshalling the full power of our governments to coordinate on necessary public health measures to protect people at risk from COVID-19, restore confidence, growth, and protect jobs, support global trade and investment. And then there's a few other things. I would focus on those: support global trade and investment. There are some major considerations now when we see all of these travel restrictions. You mentioned airlines. Air Canada came out today and said that they're going to be operating at 50% capacity compared to this time in 2019. They're also looking at 75%, even lower when you're looking at different jurisdictions in the country. This will have and is already having a massive impact. I think what's interesting to watch beyond the fiscal stimulus part of it is something that we've seen throughout the morning, and that is the varied responses from provinces where closing down restaurants or businesses or that kind of thing is concerned. We've seen, for example, Ottawa say, don't leave your house. The public health here in Ottawa say, don't leave your house unless it's absolutely essential. We saw Dr. Williams, the head of public health for Ontario, say today, well, we're not really at the point yet where we're ready to say this is a state of emergency and you need to shut down your business. I think there are sort of a number of questions from Canadians about, I guess, some inconsistencies there. Does it depend on where you live? What should we do about our businesses? And that will also, my point is, I guess, feed into the overall economic need as well, and likely feed into what the federal government ends up announcing for help.
Yeah, the other thing that the G7 leaders decided is that their finance ministers will now meet on a weekly basis, I guess, to stay up to date as this starts to unfold, as it is at a fairly rapid pace right now. They also say in that release, Vashi, they'll coordinate efforts to delay the spread of the virus, including through appropriate border management measures. I'm not sure what that means at this stage. Obviously, the concern for Canada and the U.S. would be if we share the biggest, the largest border, and we are so reliant on trade and even the movement of individuals across the border for all sorts of reasons, including including work, it becomes really problematic to even consider closing down the border to the United States. I'm not even sure how that would work. I'm sure, as the Prime Minister has said, that everything's on the table, but they have to make sure that it won't hit the economy too hard as well.
Yeah, I think actually from where I sit, that and from the people that I've been speaking to who are around those who are making these decisions, that is you've hit the nail on the head. That is the most difficult balance to strike, because what especially officials in Ontario are seeing is an influx of cases from people who have traveled to the United States. Yes, the epicenter is Europe right now, and certainly there are concerns about travelers who have come from Europe. But what we are looking at now is a number of people who left, for example, on vacation last week prior to the pronouncement from the public health officials federally that you shouldn't travel outside of the country. They left. A number of them went away. They're all going to be coming back at the end of this week and into next week. And when the rate of transmission is what it is right now, I know for a fact a number of people in Ontario's government, especially in the public health side, are very concerned about what the impact of those travelers will be. And that is specifically focused, for the most part, on the United States. But you're absolutely right. When you look at the hit this economy is poised to take already, how do you manage a border that is so incredibly crucial to, like, not just the movement of goods, but the movement of people too? I can't imagine what kind of a policy sort of conundrum that is.
And we should point out that part of that, because Ontario does have the most number of cases, and as you say, Vashi, so many people coming back, the health department here, ministry in this province, moved to start cancelling non-elective health procedures because they simply need to make sure that the hospitals have capacity. If this starts to become a situation where more people do need hospital care rather than just to be at home.
Yeah, and that's a huge concern. We saw also, for an example, an acknowledgement of that and the increased probable need for healthcare services, for equipment in Finance Minister Rod Phillips, Ontario Finance Minister Rod Phillips, who says basically the budget is scrapped. It was supposed to come out on March 25th. It will instead be replaced by a fiscal update that will wholly be concentrated on addressing the impact of COVID-19 in Ontario. So that means extra money already for healthcare. That means any kind of stimulus that the provincial government has to inject. It's different legislation that's coming now for workers. I mean, everything sort of like all of the status quo stuff that was supposed to happen even last week, I think it was just about a week ago they announced the budget date, has now been scrapped, and instead they're going to focus an entire fiscal update just on addressing this challenge. And my guess is even what they think might address it now will have changed by March 25th.
Yeah, if we've seen anything, it's that this story moves very quickly. Vashi, I'll leave you there for a moment and just remind viewers that you are looking at the front door of the Prime Minister's house at Rideau Cottage here in the nation's capital. We are standing by to bring you a press conference and address to the nation from the Prime Minister about new measures his government will be enforcing today to try and contain COVID-19. We will also then bring you a press conference with some of his ministers who will be at a different location because the Prime Minister is self-isolating. To answer more questions about the details. This comes after the government moved and ramped up measures very significantly on Friday on a number of fronts, both on a public health front and economically. And it also comes perhaps just days before we're expecting a major fiscal stimulus package from the finance minister to deal with what you're seeing there on the right of your screen, which is the markets in some chaos again today. Major losses on the markets again today. It did seem a little more secure on Friday, particularly after the announcement by this government, but there are again losses again today. David Cochrane joins me now here again in Ottawa. It's interesting to see, as Vashi and I were talking about, David, how quickly this story moves and how quickly it changes. I even noticed Nunavut today, which last I checked had no cases of coronavirus, is decided to shut its schools. So people are moving in a preventative way in some areas of this country, but moving really, really quickly to try and stop or slow this down as much as possible.
Yeah, well, Rosie, I mean, the total number of cases in the country is still relatively low when you look at the global scene, but they've doubled or more than doubled since Friday. So when you hear health experts, people like Dr. Theresa Tam saying you need to flatten the curve, that is slowing the rate of growth so that the peak infection stage that we get to in the country doesn't overwhelm the health system. Her comment about the window is narrow and the window may be closing is probably the most significant thing that has been said in this country in the last couple of days, because that is the battle line. That is the goal. That is the fight. It's to flatten that curve. The virus is in our population. It is spreading. People are bringing it back as they travel and come back from the United States. It is about the mitigation measures that are now deployed domestically to stop that viral contagion from overwhelming the health systems, and in particularly in places like the north. This is why it's important for them to take these measures, because the health facilities aren't there, and in a lot of places the housing capacity simply isn't there to do self-isolation or mandatory quarantines if it gets to that point. And that's why on Friday, when we heard Transportation Minister Marc Garneau say we're delaying the cruise season until at least Canada Day for the bulk of Canada, we're canceling it for the year in the north, simply because they don't have the facilities or the capacity to deal with a localized outbreak. So that's, you look at the number, 377 confirmed or presumptive cases in Canada right now. We were under 200 before the weekend. So that just gives you a sense of how quickly it is moving here, and underscores the need for urgent action from all levels of government, but also every single person in Canada.
Yeah, and just to remind people, the significant shift over the weekend from a federal perspective is Dr. Theresa Tam saying yesterday that anyone arriving from another country to Canada needs to self-isolate for 14 days. It is no longer a question of whether you have symptoms or whether you've been to some of the hotbeds of this virus, like Italy, like China. It is now that you absolutely must do it. That is the advice. If you are coming in from another destination back into Canada, then you need to self-isolate for 14 days, and you will now get that information at the airports, and that is what they are recommending. Let me bring in Dr. Michael Gardam again, if I can. Dr. Gardam, I noticed this clip.
Great.
I noticed a clip of one of the, I forget his name, but one of the doctors at the WHO over the weekend, and everyone kept circulating it on social media, and his message to policymakers around the world was, act fast, act as quickly as possible. Don't worry about perfection. It's the speed here. Is that the case, that it is better in instances like this to make mistakes rather than to go too slowly? Oh, I don't know if
sorry.
we have Dr. Gardam. Yeah, sorry. There we go.
Yeah, absolutely. It is better to make mistakes and err on the side of caution and moving earlier rather than later. You think about the fact that we have almost 400 cases today, or 350 cases today. By the middle of the week, that could be 600. By next Monday, that could be 1,200 cases, to give you a sense of the doubling of this every sort of 3 to 4 days. And so we really, if you're going to act, you need to act very quickly, and you need to act when the numbers are still relatively small.
It's really hard, right? You see everybody sort of weighing in on everything the government's doing right now. It's really hard to know as a regular person what is the right thing to do, and has the government done it quickly enough? Are you able to sort of assess where Canada is at versus other countries right now?
Yeah, I mean, we've done better than most, because we're taking actions that are very similar you're hearing in Europe, but we're not as in bad shape as Europe. So we have done these earlier, probably about a week earlier than Europe, which I think is very good news. And I think that, Canadians as a sort of a group, we're still struggling with what exactly does this mean? And what I've been explaining to people over and over again is it means you're not around people. And that means, choosing to go to a crowded coffee shop for 2 hours, you're not going to do that. You're not going to go to a play. You're not going to go to the movies. Frankly, you're going to try to avoid public transit. You're not going to go over to your friend's house. That's really what it means. And you're only going to be around people because you have no choice. For example, if you do have to take transit because you have no choice, then fair enough. If you have to buy groceries because you obviously have no choice, then fair enough. But otherwise, it is really making choices every step along the way. And if we all can do that, we'll be in so much better shape 3 weeks from now than if we hadn't done anything.
And that's, I mean, I guess we can't emphasize enough how important that is. It does seem like in Italy that message wasn't received maybe as seriously as it should have been. But if you do it, it does actually change things significantly.
Yeah, it does. And we, this isn't even hypothetical anymore. I mean, we've got data from a number of countries that show we can see when they brought their social distancing measures in. You can actually see the shape of that so-called curve flattening. You can actually see it happen. So this isn't theoretical. This is real. The trick is how many people are going to get that message? I mean, one of the questions I got asked is, now that schools have been closed and kids have been quarantined, are they all going to go to the mall? Well, no, they shouldn't be at the mall, right? That's the whole point, is that they should be at home.
Yeah, even play dates. Don't bother. There's no point right now in doing that.
Don't do it.
Yeah, adult play dates either. All right. Dr. Michael Gardam joining us again from Toronto. Thanks, Doctor. Appreciate you weighing in. Just to remind viewers what you are looking at there, that is the podium where the Prime Minister will eventually come out and speak to Canadians. You'll remember perhaps that his family is self-isolating, has been now for a few days anyway, since his wife, Sophie Gregoire Trudeau, tested positive for COVID-19 after traveling to Europe about maybe 10 days ago. The Prime Minister has not shown any symptoms to date. He has not been tested because they do not test asymptomatic people. But he and his family, his three kids, are all staying sort of on lockdown in the house because that is the advice of public health officials for him and for anyone else. He is going to come out and speak to us soon about new measures that we expect will impact both airports and travel. Something to do with both of those measures. This at a time when other countries around the world are doing the same kind of thing. The European Union moving today to ban non-essential incoming foreign travel for a period of 30 days. That affects some 30 countries. The United Kingdom's Boris Johnson, who's been under a lot of scrutiny for the way he's handling things in his country, which is slightly differently than we are doing here. He has said stop all unnecessary contact and stop travel. And the U.S., of course, moved last week to ban European travel for 30 days, excluding the U.K. They have now added the United Kingdom to that list. Of course, if you're a citizen of those countries, you can get back in, but will need to self-isolate. But if you are not a citizen, you will not be allowed into those countries for at least a month. Vashi Kapelas is joining us now again. So he's a little late, the Prime Minister, and that's because this is a very fast-moving, fast-changing story, I would imagine. Certainly the government was working through the weekend to come up with the measures that we will hear today and more measures. There was a cabinet meeting yesterday where this was a I don't know if stressful is the right word, but not everyone agrees on the best measures, and they all have to be very aware of how it impacts the country writ large.
Yeah, certainly. I mean, I think also we could note that he's usually late for press conferences.
Yeah, always,
and I'm getting a lot of messages. I would say only that this time is a bit different. Normally we're so tuned in and people who are politically interested are tuned in. My phone is exploding right now with a ton of moms who are watching, who are wondering what to do with their kids, if what's going to be closed, that kind of thing. So I know there is heightened interest in what the government has to say today. And I think you're absolutely right, Rosie, in that. And that question that you asked the doctor was of particular interest to me because I think the reason I'm getting so many questions, and this is also on social media, people were asking me literally on the street today as I was walking to work, can you just find out what the one answer is on question A, B, or C? And it could be taking your kid on a play date. It could be, what are they doing at the border? I think that there is a real hunger for one set of instructions, because you're absolutely right. People are sort of questioning what their own behavior should be and getting a lot of different information from different sources, and all government sources, all government officials, just at different levels of government, be it municipalities or provinces. And so I think there are some very genuine questions towards the federal government right now about the stuff that they can control. And we were talking about it earlier. The border is one of them. If they are strengthening measures at the border, if they are going to funnel international flights and maybe passengers based on where they are from to only certain parts of Canada, when does that happen? How does it happen? What do they anticipate the impact will be? And I think the question that you asked the doctor as well around the border is an interesting one, because for so many weeks now, even when we ask the question, we've been told, well, the science doesn't support that will make an impact, even though we were seeing so many travelers so many people diagnosed with having the virus as having traveled. And I'm not a scientist. I don't, I read as much as I can, but I don't know the answer to that. And now it looks like, at least from what I'm hearing, especially around the cabinet table, there is a shift. There is sort of an acknowledgement that people are worried about those who have traveled, as we were talking about earlier, especially from the US, but also Europe. And the attitude seems to be like, let's do anything we can to mitigate that. And I wonder, I guess, what how that decision is made, how it has been made, why it wasn't made earlier. I think the timing questions are going to be important ones for the government.
Yeah, and you're quite right. There's lots of people asking questions already without us, fully understanding how this is going to play out. And it's certainly important for the government to try and explain how it's reached those decisions. It's been leaning very heavily on the advice it gets from public health. I would expect this is no different. But when you're making decisions, not unlike just the civil service today, everyone was told work from home. Well, part of the reason why that decision was made so late was because there are actual consequences to that happening. If you have casual workers or what have you, it's possible they don't get work anymore if there aren't measures in place. So all of these decisions have these domino effects. And while you're working to contain or mitigate the virus, you have to think about all the things that could topple over at the same time. And I think that's what has been difficult, I would imagine, around the cabinet table. I would say the other thing too, Vashi, that I think, people may be getting, a little confused or frustrated with is the split of jurisdictions, which, is a lovely feature in this country, but sometimes can make it a little confusing because you saw, for instance, Ontario move to shut down schools very quickly. Alberta only just did it. These are all obviously provincial jurisdictions, and they have the power to make those decisions with their own provincial public health officers. And that's why you're seeing a lot of that different kind of messaging across the country as well. But certainly the federal government has a leadership role to play in what it's telling Canadians and what it's signaling to Canadians about how they should behave.
Yeah, and does it become sort of less voluntary, more instructive, more directive? I think that is also a sort of a cause of, if I could say, self-doubt for a lot of people. Well, they're saying that's their advice, but what does that necessarily mean to me? And what does it mean to an airline company or insurance or that sort of thing? And I think you're right about the jurisdictional stuff. And I'd take it even a step further. It's not just provinces and federal government, but the municipalities too. They all have their own public health structures. So a lot of the advice we're getting based on those public health officials, as I was mentioning before, kind of differs. So you've got Ottawa Public Health really saying stay inside. You've got Ontario Public Health saying we're not at the point where we're going to close down any businesses. Will that end up being something that the federal government weighs in on? It's kind of unclear at this point. And also I think it's hard to know, and maybe it is for them too, but what's the marker? So at what point does it become instructive to say you've got to close things down, or we need to declare this state of emergency? Who can even declare that, and what becomes available to them? I think there are just so many unanswered questions, and the end result is you have a lot of Canadians who are unclear about exactly what actions they are to take.
Yeah, and it's an anxious time anyway. So if you're struggling to make decisions around your own health and your family's health, that makes it a lot harder. I should point out that we are being told, and I would say only being told, that we are 5 minutes away from the Prime Minister coming out to speak to Canadians. This is not a result of the self-isolation that the Prime Ministers, all Prime Ministers, I would say, tend to be a little tardy, and that is because they are probably finalizing what they're going to say and how they're going to respond to some of these key questions that we've been talking about. As the government over the past 7 days, 5 days, has really ramped up significantly the way it's addressing the outbreak, both from a public health perspective and an economic perspective. Extraordinary times that we are in. This is, and this is partly why it is so difficult for all of us to understand the decisions and the decision making here, is that this is really an unprecedented time for the country and the world in many ways, as the government looks for ways to respond that make sense right now. I'm going to go quickly to Megan Fitzpatrick, who's at Toronto's Pearson Airport, knowing that I might cut you off at any time, Megan. Are there
no problem.
We can't see you because we're looking at a door, but are there people there? And I only have about a minute, so I'll just get you to do it quickly.
Yeah, it seems like there might be some flights coming in now, Rosemary, because there are a few more people here in the arrivals terminal waiting for their loved ones to arrive than there were when we talked a few minutes ago.
Okay, Megan, I'm sorry, I'm going to cut you off. I'm going to cut you off. Here's the Prime Minister, because we've been waiting for him. Let's bring him to everybody live right now.
Hello, everyone. Bonjour tout le monde. Over the past few days, we've seen COVID-19 spread around the world at an even faster pace. Canada is no exception. From the very beginning of the outbreak, our government took necessary measures to protect your health and safety. We've based our response on science and evidence, on input from our world-class health professionals and authorities. We continue to base our response on keeping Canadians as protected and as supported as possible. We assured you that as the situation evolved, our response would evolve too. As the virus continues its spread, we've decided to take increasingly aggressive steps to keep you and your family safe. D'abord,
First of all, we will be closing our borders to people who are not citizens or permanent residents of Canada. This measure provides for certain exceptions, particularly for crew members, diplomats, and people whose immediate and members of their immediate family.
First, we will be denying entry to Canada to people who are not Canadian citizens or permanent residents. This measure will carve out some designated exceptions, including for air crews, diplomats, immediate family members of Canadian citizens, and, at this time, U.S. citizens. Deuxièmement,
Second, airlines will receive the formal order to ban all travelers presenting symptoms from getting on an airplane. Airlines will do a basic assessment of each passenger's health based on the recommendations of the Public Health Agency of Canada. So that means that any individual with symptoms will not be able to enter Canada. I know that this is news that will concern many Canadians who are abroad. I can assure you that our government will continue to support you to help Canadians who are asymptomatic to return to Canada. We will introduce an assistance program for Canadians abroad. Canadian travelers will be able to receive funding to help them return to Canada or cover essential costs while waiting to return to the country.
Air operators will be formally mandated to prevent all travelers who present symptoms of COVID-19 to board a plane. Air operators will be required to complete a basic health assessment of every air traveler based on guidance from the Public Health Agency of Canada. This means that anyone who has symptoms will not be able to come to Canada. I know this news will spark concern among Canadians traveling abroad. I want to assure you that our government will not leave you unsupported. To help asymptomatic Canadians return home, our government will set up a support program for Canadians who need to get on a plane. Canadian travelers will be able to get financial assistance to help them with the costs of returning home or temporarily covering their basic needs while they wait to come back to Canada. Troisièmement,
Third, starting on Wednesday, March 18th, only 4 Canadian airports will receive international flights. Pearson in Toronto, Montreal Trudeau, the International Vancouver Airport, and the Calgary International Airport. For the time being, domestic flights, as well as flights from the United States, Mexico, Saint-Pierre-Miquelon, and the Caribbean will not be affected by this measure. Travel restrictions announced today will not apply to trade or businesses. We will continue to ensure that Canada can continue to receive important goods.
Third, starting Wednesday, March 18th, only 4 Canadian airports will be accepting international flights: Toronto Pearson, Montreal Trudeau, Vancouver International Airport, and Calgary International Airport. At this time, domestic flights, as well as flights coming from the U.S., Mexico, the Caribbean, and Saint-Pierre-et-Miquelon, will not be affected. The travel restrictions announced today will not apply to commerce or trade. We will continue to ensure the supply of important goods to Canada. I know that these measures are far-reaching. They are exceptional circumstances calling for exceptional measures. Earlier today, I had a call with our G7 partners to inform them of these important changes. From the very beginning, Canada's response has been based on the latest available science and advice from our world-class health professionals. Today's announcement is no different. These measures will help save lives. Depuis le début,
from the outset, it has been important for me that Canadians have access to the recommendations of healthcare professionals and experts. It is their knowledge and their expertise that has been guiding the measures taken by the government, but also by individuals. Dr. Tam and public health professionals and the minister are doing extraordinary work to protect the safety of Canadians and keep them aware of the latest developments on a regular basis. As Dr. Tam said yesterday, public health authorities have administered 25,000 tests to date, and their work continues to ensure that the largest number of Canadians possible can have access to the latest information. Health Canada will be providing a daily update at the same place at noon, starting tomorrow. Today, their press conference will immediately follow mine.
Public health officials and our ministers have been doing a tremendous job of keeping people safe and providing regular updates. As Dr. Tam said yesterday, public health authorities have conducted 25,000 tests to date, and this work continues. To ensure that more Canadians can have access to the latest information on COVID-19, Health Canada will be holding its daily update at the same place at noon, starting tomorrow. Today, their press conference will take place after my remarks.
The measures announced today can be added to all that our government has been doing up until now. Last Friday, Minister Morneau announced new measures to financially support workers and employers right across the country.
$10 billion available in additional support for Canadian businesses. This is a tool that has worked before in difficult circumstances, and we're confident that it is going to work again. The economic impact of this pandemic is shifting hourly, and we recognize the stress and anxiety that it is causing. As I've said, we are prepared to see Canadians through this time. We will have additional measures to announce as early as tomorrow to support Canadians, particularly our most vulnerable. Right now, provinces and territories are facing different realities and risks, which means taking steps that make sense for people in each area. At the same time, we also need to keep building an aligned, Canada-wide approach. On Friday, I held a telephone meeting with the Premiers and Deputy Prime Minister Freeland, and information has been flowing continuously since. We've been in constant communication with the provinces and territories so that there are no barriers between our jurisdictions during this critical time. During the meeting, I spoke to premiers about the $1 billion COVID-19 response fund our government has put in place, which includes support for provinces and territories and their healthcare systems so hospitals can prepare. We can still slow the spread of this virus, but as Dr. Tam said, that window is closing. So far, we've seen many provinces take aggressive steps to protect their communities. I want to thank them for their work. It's time to take every precaution to keep people safe. The COVID-19 Response Fund also includes support for Indigenous communities. On Friday, I spoke with First Nations, Inuit, and Métis Nation leaders to discuss the work we're doing together on preparedness and mitigation efforts. Minister Miller also provided an update on our regular coordination with Indigenous partners, as well as the provinces and territories. Minister Van Daal has also been connecting with the territories and is working on exceptional measures to protect the North. We're making sure that everyone, no matter where they live, is prepared. The
measures announced today can be added to the recommendations of public health officials. I want to remind all Canadians that they should avoid non-essential travel outside the country until new information is provided. We also recommend all those who are currently aboard to return to Canada while it is still possible to do so. I want to be clear. If you are abroad at this time, it's time to come back home. If you have just returned, you must self-isolate for 14 days. And finally, all Canadians should stay home. By staying home, we can not only protect your health and the health of your family, but also ensure that our healthcare professionals and our healthcare system can provide more support to those who truly need it.
All Canadians that they should avoid non-essential travel outside of our country until further notice. Canadian travelers should return to Canada via commercial means while it is still possible to do so. Let me be clear. If you're abroad, it's time for you to come home. If you've just arrived, you must self-isolate for 14 days. And finally, all Canadians, as much as possible, should stay home. By staying home, you can not only protect your health and that of those around you, but ensure that our healthcare professionals and our healthcare systems can focus on those who need their help. This is an adjustment for all of us. We know that staying home is an important step to protect the community and each other. We all have to do it. But I want to remind all Canadians that social distancing doesn't mean we have to stop talking to each other. Pick up the phone, write an email, FaceTime. The strength of our country is our capacity to come together and care for each other, especially in times of need. So call your friends, check in with your family, think of your community. Buy only what you need at the store. But if you're heading out to grab groceries, ask your neighbor if you can get them anything. And if you know someone who is working on the front lines, send them a thank you. See how they're holding up. In Canada, we're lucky to have outstanding healthcare professionals. I want to thank them once again for their tireless efforts to keep us all safe. At the same time, our government is doing everything it needs to do to keep you safe, to keep your family safe, and to keep our economy strong. No matter what our next steps look like, you can rest assured that we will take them together, with premiers and mayors, with doctors and families and neighbors, because that is what Canadians do in difficult times. We pull together and we look after each other. Merci beaucoup tout le monde.
Radio-Canada, Mr. Trudeau, the response of your government is being said to be too slow by many. Particularly, they're saying that there were lax measures in airports. Are you taking any responsibility for what your government has done? Well, we understand that the situation is evolving very quickly. We have taken significant measures in recent days, and we will continue to do so. As of today, I understand the concern that people have, but I can assure you that the measures are in place to keep people safe.
I will highlight that the situation, as we all know, has been evolving extremely rapidly. We've taken measures over the past number of days to keep Canadians safe, and we're taking more measures, significant measures today. I can understand people's frustration, and that's why we're ensuring that there is more that will be done every step of the way to keep Canadians safe.
So you don't think you've made any mistakes thus far? Well, there are certainly things we have to do, and we will continue to do more every day. Now, with respect to the United States, why not include the United States? So what's part of that equation? We are very closely coordinating our operations with the United States. In recent days, I've spoken several times to President Trump. We recognize the integration of our two countries, and that demands a particular level of coordination over the next steps, and that is what is happening.
Prime Minister, you've been telling us for several weeks now
that a travel ban was not required, that it wasn't helpful. What changed your mind overnight, and do you regret not acting sooner to take this step that's taken by other jurisdictions, other countries?
This situation, as everyone knows, has been evolving extremely rapidly, and the recommendations of public health and public safety have been evolving as well. At every step, we've taken the best advice of our public health officials, and now is the time to take this particular step. It is a significant step. It is a step that we take in exceptional circumstances, but it is the right step to be taking today.
Another brutal day on the stock markets this morning. TSX is down 7% just this morning, actually almost 8%. What is your message to Canadians who are seeing their retirement savings being wiped away, and especially those who are thinking of retiring in the near future?
Our focus right now is on ensuring that Canadians who are staying home from work have enough money to be able to buy groceries and pay their rent. These are measures that we will be moving forward with in the coming days to ensure that people can keep themselves and their loved ones safe and healthy. We will, of course, be moving towards supporting businesses, as we already have, with significant access to credit of $10 billion and other measures to ensure that in the short term we are able to continue to support each other. In the medium term and then into the long term, we will need to invest significant amounts to restore people's confidence in the economy, to restore the kind of growth that is going to ensure a better future for all Canadians, and we will do those things as we need.
Just in the same vein, we know that there are announcements coming about help for families, but can you tell the families who need help when they will be able to receive it? Well, we will be making money available to families, the most vulnerable ones, in the coming days. We understand that there are many people out there who are very worried about their ability to feed their family or pay their rent. So these are concrete concerns, particularly among people who do not have employment insurance and hold vulnerable jobs or part-time jobs. And that's why we will be making announcements in the coming days that will show that these people will receive the necessary money to come through this period. When will people get that money? We'll be announcing that in the coming days.
Health officials say many of the new cases can be traced to the U.S. Why are U.S. citizens exempt from entry restrictions to Canada?
We have been collaborating very closely with the United States, coordinating various measures that we've taken together. The level of integration of our two countries is quite particular, which is why we need to do some more work in order to ensure that we're doing what we need to do in the right way. But our first preoccupation is and always will be the continued safety of Canadians, and we will take the measures necessary to keep Canadians safe.
But then why are U.S. citizens being allowed into Canada? What does this mean for the U.S. border? When is it going to be closed at all? At
this point, we are closing our borders to all non-Canadian or non-permanent residents of Canada. We are recognizing that for the moment that measure does not apply to U.S. citizens, but we will have more work to do in the coming days to ensure that we're doing everything we need to do to keep Canadians safe and to ensure the flow of goods and necessary equipment to Canadians.
So you are not ruling out the possibility of closing that border, but what would be the triggers for that to happen? Well, as I say, at every step, we will not rule out anything that could help to keep Canadians safe. We will make our assessments step by step as to the best way of keeping everyone safe. We are moving forward today, and there will be other announcements in the coming days, and every single time we will be assessing how we can better protect Canadians and keep our country and our economy and our citizens safe, as well as ensuring the proper functioning of our healthcare system. Now, some people believe that the U.S. will become what Europe is now. Are you concerned about that? Well, as I said, we are not ruling out any measure at this point. Everything is on the table to protect Canadians, but we are going to do this step by step, as we have from the beginning. We'll take the necessary measures when they become necessary.
You've said that your decisions thus far have been dictated by science. What is the science behind leaving the U.S. border open but denying entry to other travelers?
We recognize that the level of integration of our two economies and the coordination that we've had over the past while puts the U.S. in a separate category from the rest of the world. But we will continue to coordinate with the U.S. We will continue to examine next steps and measures that must be taken. Today we are announcing that we are closing our borders to all foreign nationals from everywhere around the world. We will have more announcements to make in the coming days as this situation evolves.
You said also that citizens people returning to Canada must self-isolate for 14 days. Are you preparing any measures to ensure that they do that, or is this still voluntary?
If we put in measures for mandatory self-isolation, as many people have looked for, there would need to be enforcement measures around that, both by public health and by public safety. We know that at this point, the expectation that people self-isolate is something that we've asked of Canadians around the country, that we are expecting people to do. We know that Canadians want to keep themselves and their families safe, and we are confident that people will do what is necessary to keep themselves, their loved ones, and their neighborhood safe.
Christopher Nardi, National Post. On Friday, Health Minister Patty Hajdu said, and I quote, "Canadians think we can stop this at the border, but what we see is a global pandemic, which means that border measures are highly ineffective and, in some cases, can create harm. We see that in countries that had the worst expressions had the tightest borders." What changed?
We have seen over time various countries take very stiff border measures that proved ineffective. In Canada, we based our decisions on public health recommendations that ensured that Canada's approach worked for many, many weeks in keeping a very slow spread of the virus in Canada through contact tracing and other measures. We've now come to the point where the best advice from public health officials is that additional border measures on top of the social distancing measures that we are encouraging domestically is the right combination to move forward now.
How we've seen throughout the weekend complaints that airports weren't able to keep up, they weren't advising travelers. What makes you think that suddenly closing the border and redirecting flights to 4 places, the bureaucracy will be able to adapt and actually enforce these measures?
We've already seen shifts at the airports where every single traveler gets asked if they have symptoms, gets asked to acknowledge that they've been asked to self-isolate. We will be putting forward more support in those 4 airports as well. I want to highlight that local jurisdictions are also stepping up to assist in those 4 airports. We know that there is much more that we can do, and that's what we are doing.
There is a senior WHO official who said the problem in society is that people are afraid of making a mistake and the consequences that could have for them. Does that apply to you? No, on the contrary, at every single step we have taken the necessary measures recommended by the best possible experts to keep Canadians safe. And that's one of the reasons why, from the very beginning of this virus crisis, we have seen measures working in Canada. We are on a trajectory that is much lower than in other Western countries. So we are also taking additional measures today because it is time to do that. We had a cabinet meeting yesterday where we had a lengthy discussion about various recommendations, and we're confident that what we're recommending today or doing today is necessary to help Canadians stay safe. Of course, the situation is evolving all the time, and we will be updating these measures as new ones are required. You say you're relying on the recommendations of experts, but they don't all agree necessarily. So does there come a time when a political decision is necessary to reassure citizens? Well, decisions are not being made by experts. They're being made by people who are elected to serve Canadians. And those decisions are made at the result after discussions with experts. And we have a responsibility as a government to make those decisions. And that's exactly what we're doing. Thank you very much.
And that's the Prime Minister of Canada speaking to Canadians for the second time from just outside his home at Rideau Cottage with some significant news today. The government making the move to limit entry into this country to Canadian citizens, permanent residents, and American citizens. All other visitors to Canada will be banned from entering this country. This is a decision that could affect hundreds of thousands of travelers, it is safe to say. The government also saying today that no one that is showing symptoms of COVID-19 will be allowed on board a plane back to Canada. The government is providing assistance and support for those people if needed, financial assistance as well. The Prime Minister also making it very clear today that Canadians who are overseas need to come home, and that if Canadians in the country need to stay home. All right, let's bring in the host of Power and Politics, Vashi Kapelas, and the CBC's David Cochrane to break down a little bit what we heard here. So a significant measure, Vashi, I'll start with you, around border restrictions and denial of entry, with a big piece left out, and that, of course, is the United States.
Yeah, with a very big caveat there. I think, look, if you were to compare the announcements today with any of those that have been made last week, for example, you could note, as David Cochrane did earlier before the special, that this was going to be, and it is, a very significant departure from the message that we have heard prior to this. It is essentially shutting down the border to certain groups of people, but you're absolutely right. You saw those questions from the reporters directed to the Prime Minister. Most of them were sort of focused on the idea that the U.S. is exempt from what was announced. So permanent residents, Canadian permanent residents will be allowed in, Canadian citizens will be allowed in, but so will U.S. citizens. The Prime Minister was asked over and over again, why are you exempting those citizens? It's not like this virus isn't an issue in the United States. In fact, the handling of it and the spread of the virus is under immense scrutiny south of the border. So why exempt them now? And he was very careful with his words. He talked about speaking with President Trump often and the integration of the two economies here. I imagine that's a big part of whatever decision is being made. And as you and I, Rosie, were talking prior to the start of this press conference, not only the economic implications, the political ones as well. I know that the Premier of Ontario is pressing the federal government very hard to do something about the border with the U.S., to do something about the number of people who have crossed over from the U.S. into Canada and are contributing to the spread of the virus. That is a big concern for Ontario when you look at sort of the number of cases over the past few days and where they are originating. And so I think that will continue to be the question for the Prime Minister going forward. He kept saying at the moment. Yes, they have decided they have decided to exempt U.S. citizens. How long does that last, and what are the ramifications if that were to change?
Yeah, I mean, the ramifications clearly are economic, as the Prime Minister said time and time again. There are, I think it's $2.5 billion in goods and services per day, and I think just under 500,000 people going back and forth across the border. So that's what it's about. That puts it in a different case than another country. Of course, Donald Trump also said that he was going to leave the border open to people from the United Kingdom, and he had to change his tune as well because it simply wasn't manageable. Let me just give you some stats that my fabulous producer Phil has pulled out, just so you don't think I just know this stuff. In 2019 alone, 7.5 million travelers came from overseas, from countries not including the United States. So it's a significant portion of people right now, hundreds of thousands of people who will no longer be allowed in. And David, really that decision seems to be on a public health basis, first of all, and then juggling that, and this is a very difficult task, juggling that with the economic reliance that we have on the United States.
Yeah, I think kind of if you pull back and just look at what has happened, this is a truly extraordinary day. Yep. I mean, the advice from the Government of Canada has gone from Friday to Canadians come home to essentially telling the rest of the world outside of two countries, to stay home. Don't try to come here because of this public health emergency. I mean, the national government and all of the provincial and local governments are essentially engaging in a massive exercise of risk mitigation right now and asking Canadians to follow along. And so you heard the Prime Minister essentially say we need to pull together as a country by staying apart. Don't leave your house unless absolutely necessary. Just do massive social distancing. And you go back to this United States situation. You do have the public health officials. We heard it from Ontario today, saying a lot of cases are being traced back to travel from the United States. Now, these are Canadians coming home, not necessarily Americans coming in. But this is going to be a live concern. But it's much easier to shut down flights from continental Europe and from parts of Asia than it is to just stop that border travel in the United States. Because go back to the NAFTA conversation, Rosie, that example the government used about the interconnectedness of a simple car part crossing the border like 13, 14 times before it was put into a car with the whole country of origin thing. That applies to our medical supply chain, to the equipment we need, to essential medicines, and to the food supply. So if you do get to the situation, as the Prime Minister has said, and as we've heard from Cabinet and senior government officials, there is deep anxiety about what's happening in Seattle and in Washington State and in New York State. You know, border states with a lot of two-way travel. There's deep concern over that. And it is a live issue and a real chance that there will be tighter restrictions at the Canada-U.S. border. One thing I think we need to hear from the ministers who are going to come out and sort of get into the fine details of things is, are we going to enhance screening to include medical screening at the Canada-U.S. border? If we're stopping Europeans and Asians and Africans and wherever from coming here, what extra measures are we dealing with in the U.S.? Because if you look at the story of the virus down there, it's not a particularly comforting tale.
Now, again, the most recent figures that we have in terms of testing in that country versus this country, 25,000 tests in Canada, 23,000 tests in the United States. Remember,
with
Canada's
10 times
a tenth
the population.
Of the population.
Yeah.
That's right. Okay, I'm going to bring you to the ministers who are speaking now, and will probably give us more details and answer more questions. Let's bring that to you live.
Les docteurs Tam et docteur Nou vont parler avec vous. Après cette presse-conférence, nous avons décidé que, à cause le conseil de maintenir la distance sociale, que c'était mieux d'avoir seulement 6 personnes ici à fois. Nous vivons dans une période critique et nos efforts visent à contenir l'épidémie du COVID-19 et à réduire la charge
and to reduce the burden on our healthcare system and on our outstanding professionals. Our priority is the health and security of Canadians.
We are taking a whole of government approach and indeed a whole of Canada approach to limiting the spread of COVID-19 and to keeping Canadians safe. The measures which the Prime Minister announced just now are essential to that effort. And we will continue to adapt our approach to the ever-changing environment in which we all now exist. As Dr. Tam said yesterday, Canada's window to flatten the curve is closing. I urge Canadians to listen to the valuable advice from our public health professionals and public health officials. These are and must be our entire country's trusted sources of advice and information. And what the experts are telling us is that this situation will get worse before it gets better. This is not a time to quibble about federal and provincial responsibilities or about who will pay the bill. Our clear priority is and must be the health and safety of Canadians. And I have to say, I am so proud of how Canadians, from business to labor, from Indigenous leaders to premiers and mayors, and of course our outstanding healthcare professionals, are all rising to the challenge. Team Canada truly is coming together. Together we can meet this challenge, and we will. We must all act now, and we must act together. Starting today, we will be formalizing formal federal government updates as daily briefings for Canadians. We will also provide a daily briefing for all parliamentarians. So now we're going to hear from the Minister of Health, Patty Hajdu, then the Minister of Transport, Marc Garneau, then the Minister of Public Safety and Emergency Preparedness, Bill Blair, et mon cher collègue, le président du Conseil
and my dear colleague, the President of Treasury Board and the Vice Chair of the Cabinet Committee on COVID-19, Jean-Yves Duclos. Thank you.
Well, thanks everybody for joining us, and good afternoon. As Canadians know, the cases of COVID-19 are rising in Canada, and all levels of government have been working together to prepare and support Canadians through this unprecedented health crisis. First, I want to offer my deepest thank you to those on the front line, the public health officials, the border service agents, the healthcare workers, and the many others who are working so hard on behalf of all of us. And I also want to thank all of the other workers who are often unseen and unsung. The cooks, the cleaners, the drivers, and others who are keeping all of the things that we need running. As you've heard Dr. Tam say, now is the time to pull out all of the stops to flatten the curve or slow the rate of infection.
We must try very hard together.
And it will require much personal sacrifice. And it will require all of us helping in many different ways.
Together, we can help our families, colleagues, and communities.
The measures that we take together now will protect people in our communities who are most at risk and ensure that our healthcare system can meet any surge in demand. All of us can take actions to reduce the spread of COVID-19. Stay at home, wash your hands well and often, and practice social distancing. I know that many people are worried about running out of food and other essential supplies. Please know that we are not running out of food or other supplies. The Retail Council of Canada is working very closely with our government to ensure that our supply chain remains strong. Please don't buy more than you need in a 2-week period. Remember your neighbors, those people that buy just in time, and buy only what you need. Be kind to one another. Even though this is going to be very hard, Canada is strong, Canadians are strong, and we've been through times that are hard before. The things that we do now that require sacrifice and generosity will get us through this time together.
OK, et maintenant le ministre Garneau.
And now Minister Garneau.
So let me get into some specifics about travel. Today, as Minister of Transport, I am enacting measures under the Aeronautics Act in order to reduce the spread of COVID-19, especially through international travel. As the Prime Minister stated, effective March 18th at noon, Canada will deny boarding to all foreign nationals on flights to Canada other than transborder flights, in other words, flights from the U.S., and to any foreign national who has resided outside of Canada or the United States in the last 14 days. The measure will not apply to Canadian citizens and permanent residents, immediate family members of citizens, or permanent residents, to air crews, to travelers in transit to another country, and to diplomats. Je vais répéter en français.
I will repeat in French. As of noon, March 18, Canada will prohibit boarding for any foreign national wanting to board a flight towards Canada from any country other than the U.S., as well as any foreign nationals who have resided elsewhere than in Canada or in the U.S. in the previous 14 days. This measure will not apply to Canadian citizens or to Canadian permanent residents or the immediate family of these two groups, to flight crews and staff, and travelers in transit towards another country, or to diplomats.
Will also introduce screening measures for passengers before they board flights destined for Canada. Air operators must do basic health assessment of all air travelers before boarding, following guidance from the Public Health Agency of Canada. Any passenger, regardless of citizenship, with possible COVID-19 symptoms will not be allowed to board flights to Canada.
Air operators will also have to assess passengers before they board onto an aircraft bound for Canada, and any person showing symptoms of COVID-19, regardless of their nationality, will not be authorized to board the aircraft.
If a passenger begins to show symptoms during a flight, there are procedures for dealing with this, including notifying air traffic control with details of the situation so that that particular passenger can be met on landing. In addition, effective March 18th at 12:01 a.m., in other words, a minute past midnight on Tuesday, all flights from Europe, Asia, Africa, and South America will be diverted to the Montreal, Toronto, Calgary, and Vancouver airports. Flights from the U.S., the Caribbean, and Mexico can continue to land at their scheduled Canadian destinations. By keeping resources focused in certain locations, we will ensure travelers are being managed as efficiently as possible. We're working closely with the airline industry and with airports to minimize disruptions and inconveniences as much as possible. Passengers who believe their travel plans may be affected should contact their airline for information about specific flights. Domestic flights between Canadian destinations are not affected by this change. I want to thank airlines and airports for their cooperation as we manage this ongoing situation, as well as to all flight crew personnel for their cooperation. These measures will carve out exemptions for certain essential workers who need to travel frequently into the United States. They will be exempted from the 14-day self-isolation. Examples of these people are the crew of any plane, train, or marine vessel crossing the border on a regular basis, truck drivers making deliveries across the border on a regular basis, persons whose profession requires cross-border travel, and finally, we will be considering other necessary essential workers as we move forward. Thank you.
Okay, merci beaucoup.
Thank you very much. And now, Minister Blair.
I'd like to begin my remarks today by acknowledging the many questions and concerns that have been expressed by Canadians about the activities that are taking place at our border in order to screen arriving passengers. I want to assure Canadians that from the outset, all of the actions that have been taken at our borders have been informed by the evidence and the expert advice of public health. Based on the advice of public health, on January 22nd, enhanced border measures were implemented at Vancouver, Montreal, and Toronto international airports, and then expanded to all airports on February 9th. These measures initially included asking travelers if they had visited Hubei province in China, and those who answered yes were subject to additional screening. Travelers who had flu-like symptoms were referred to the Public Health Agency of Canada. And as the situation evolved, additional measures were implemented. For those who had been to Hubei, they were required to fill out PHAC contact forms, Public Health Agency of Canada contact forms. They were given surgical masks. On March the 4th, on the advice of PHAC, we expanded the questioning to include travelers from Iran, and then on March 12th to include travelers from Italy. On March 6th, CBSA expanded all of the measures to include land, border, and rail points of entry. CBSA is responding to the announcement made by Dr. Tam yesterday. Dr. Tam, yesterday afternoon, strongly recommended that all international travelers should self-isolate. CBSA had been planning and was prepared to respond immediately to this direction from Public Health Agency Canada. And here's an example of what Canadians can now expect going forward as they're being processed from return from international travel. And as they pass through our passenger information kiosks, each of them, all of them, will be asked, do you currently have a cough, difficulty breathing, or feel you have a fever? They will be required to indicate on the form an answer to this question. They will also be asked to acknowledge that they are being asked to self-isolate for the next 14 days to prevent the potential spread of COVID-19. In addition to these measures, there will be enhanced officer presence at all major airports of entry to carry out public health screening and outreach. The officers will be on the lookout for any traveler who looks ill and may refer any suspected cases to public health authorities. In addition, all passengers will be given instructional handouts upon arriving in Canada, and the handout will advise them to self-isolate at home for 14 days, to monitor themselves for symptoms, information on those symptoms, and direction to contact public health authorities if they develop any illness. There will also be increased signage at all points of entry. The important measures that have been announced today, adding additional restrictions, will make the critical work of our border officers far more effective. And for example, by limiting international flights to our 4 main airports, it allows for the concentration and efficient use of our limited resources. As we will identify ill passengers before they arrive, they'll be met at the gate by border security officers, isolated from passenger processing areas, and referred immediately to public health officials. And finally, by significantly reducing the number of non-Canadian travelers, we will see a significant reduction in those traveling to Canada, and therefore a reduction in those who need to be processed. We recognize that this is a difficult and ongoing fluid situation. I want to thank all Canadians for their patience in this trying time. I also want to assure them, as our work proceeds forward, we will do what is necessary to keep Canadians safe, and we will ensure that all of our measures are measured and based upon the best scientific and expert advice provided by our public health authorities. We will continue to work with those authorities, all of our provincial and territorial counterparts, and our international partners to do what is best for Canadians.
Okay, thank you very much, Minister Blair. Maintenant, c'est à vous, ministre.
And now, Minister Duclos. Thank you very much, Minister Freeland. As co-chair of the committee, I would like to begin by thanking all of our colleagues for their extraordinary efforts over the last few weeks to meet the challenge of this extraordinary health crisis and security crisis and economic crisis. I would also like to thank our territorial and provincial partners and mayors who are working with us to make sure Canadians and Quebecers are safe at home. I would like to assure all Canadians that the Canadian government is doing everything that needs to be done to keep everyone safe over the next few weeks.
I will just say before we take your questions to remind everyone that Dr. Tam and Dr. New will be available to you to provide that expert public health advice as soon as you have finished dealing with us.
Okay, so we're going to take 5 questions from the floor, then we'll go to the phones. Reminder, we're using the microphone. We're going to go Joanna Smith from Canadian Press, and then Marie Vestel Le Devoir.
Hi, good afternoon. At those 4 airports, when people are being asked to self-isolate, are they going to be asked to self-isolate there, or are they free to go home?
No, what we're instructing them after they have been processed, and again, these are for people who are not symptomatic, but for all others who are coming in, they'll ask to go home and then begin the process of self-isolation. And with the documents and information that we'll give them advice on how that might be accomplished safely and healthily.
And what measures are you taking? I mean, presuming there's going to be much longer lineups now to go through processing. That's crowds of hundreds of people, and gatherings much larger than governments are recommending people gather in. What measures are you taking to make sure that airports themselves don't become a vector for disease with these touchscreens, in particular the questionnaires?
Yeah, it's a very important question, and measures are, in fact, being put in place. First of all, as a direct result of the measures that have been taken limiting non-Canadian travelers coming in from international destinations, there will be significantly fewer people that have to be processed. But we are taking measures in the processing areas and in the hallways approaching them to ensure that proper social distancing is practiced there. There will be available CBSA officers, our border service officers, who will be there provided with masks for people who may be symptomatic and be able to take people out of those lines. And as we've also indicated, people who are symptomatic as they arrive will be met right at the gate and not put into those processing areas. I am also aware, and perhaps Mr. Garneau could mention, that other efforts are being made to make sure that the areas in which the arriving passengers are processed are regularly cleaned and disinfected to make sure that they are safe and healthy environments for this action to take place.
So perhaps Minister Blair covered it, but essentially we were in touch with the airports last night, and this is for all airports, with respect to trying to lay out things so that there is more social distancing when people arrive at the airport, whether they're on their way in or on their way out, and secondly also that increased levels of disinfection take place at the airports.
Okay, we're going to go Rivestel, Le Devoir, and then Lina Deeb, La Presse Canadienne.
Hi, I don't know if this is for Mr. Hyde or Mr. Blair, mais Monsieur Garneau, si vous voulez répondre, vous pouvez répondre en français.
Mr. Garneau, feel free to respond in French.
You're wearing your earpieces. In regards to travelers from the U.S. who are still allowed to come in, they will not be directed to those strictly 4 airports where you're redirecting traffic. They will be going still to every airport. So are there any extra measures that are being put in place for those travelers, given that Ontario Public Health today said that they have snowbirds coming back from the United States who are contaminated, for lack of a better word in English. What are you doing to ensure that those people who you are still letting in don't just spread out the virus even more?
If I may, all of those in those airports, because there are other international flights coming from the U.S. and other sun destinations that are coming in there, all of those returning travelers will be given exactly the same information. They'll have to fill out the same forms. They'll have to advise if they are symptomatic, and on the form they will also have to acknowledge that they have been advised to self-isolate. There are additional questions and observations that will be made in those airports by our officials. If anyone is symptomatic, there are processes in place to identify them and appropriate referrals to public health. And in every case, all of them will receive information to self-isolate. And that, by the way, is not just those snowbirds, as we often refer to them, people who currently are, maybe spent the winter down in Florida or in Arizona. Many of them will be driving back. That same information will be provided to them as they cross into Canada, ensuring that they understand the need to self-isolate for 14 days. That's the advice that's been given by Public Health Canada, and that's the advice that will be communicated to each and every one of them.
So in French, all Americans entering Canada will be subject to a questionnaire asking them what their health is like, and secondly, asking them to confirm that they have been informed of the requirement to self-isolate for 14 days after they enter the country. They will have to indicate that they have received this information before they are allowed to leave the airport.
Okay, and on that decision to only have other flights, not U.S., so to essentially close the border to any other countries except the U.S. and others, but about the U.S., the Prime Minister has sort of exposed his reasoning for not banning U.S. flights, saying the trade is too integrated. But how does that prevent you? You've been quoting scientific expert evidence. So what is that evidence that prevents you from banning visitors and tourists and still maintaining trade? Why can't you do one and not the other?
Let me take a crack at that on the Canada-U.S., and then I think our colleagues may all want to chip in. So when it comes to the Canada-U.S. border, I think it's very important to say that this is a situation which we are reviewing constantly, in real time, in very close collaboration with provinces and territories, with Canadian business, with unions, and very much with our public health authorities, and of course with our U.S. neighbors. The Prime Minister spoke with the President yesterday and was on a G7 leaders call this morning, and Minister Blair spoke with his colleague, his counterpart, the Secretary of Homeland Security. Canada and the United States have the longest unmilitarized border in the world, and that border, we all know, is absolutely vital to the daily life of people who live on both sides of that border. At At the same time, I think both Canadians and Americans understand that we need to constantly be reviewing the practical measures that we can and need to take to protect the health and safety of Canadians and Americans. And that is something that we are constantly reviewing and we are working on. As Minister Garneau said, the strong recommendation to self-isolate for 14 days after coming into Canada from outside Canada also applies to people who are coming to Canada from the United States. We have understood, just because of the way that that Canada-U.S. border in particular is a lifeline for both of our countries, that there do need to be some carve-outs to that strong recommendation for essential workers. People like the truck drivers who are driving trucks of food in both directions across the border. People, as Minister Garneau said, like air crews. There are other categories of essential workers as well, and that is a situation which we are closely and continuously reviewing. Je peux me répéter en français? Non, ça va? OK, est-ce que quelqu'un...
The scientific reasoning behind not still allowing trade but banning visitors. Why can't you just do one and you have to keep both open?
If I may, both of our countries, Canada and the United States, have issued warnings against non-essential travel, and so I think that is very consistent with our approach that would significantly limit the people that you refer to as tourists and others and visitors. And so, but it is an acknowledgement of essential travel, and we also recognize that in these circumstances at this point in time, that we believe that the risk of those essential workers crossing that border can be managed effectively with the screening that we've put in place and with the instructions and oversight of Public Health Canada for isolation measures where required. And so I think it is important to acknowledge that we recognize that our country's the critical infrastructure and our economies are significantly integrated, and additionally that there are Canadians on both sides, Canadians and Americans on both sides of that border who need, for purposes of their employment and to help keep Canada running properly, to be able to move across that border. But we will put the appropriate measures in to mitigate the risk that may represent to Canadians. Minister
Hajdu, I don't know if you want to add anything.
Just, I think my colleagues have summarized it well. I mean, what's called for is really a continental response, as we know, with an integration of supply chains, and in this case, critical supply chains that include food and essential goods that Canadians rely on every day. What we do on the American border is going to have to be done thoughtfully and in partnership with our American cousins, as well as our Mexican partners. And so this week, I have a scheduled call with Secretary Azar and my Mexican health counterpart to talk about a North American approach. Obviously, there are challenges in this situation that are unprecedented, but I know that Secretary and Azar both believe that we have to be cautious and prudent in how we apply this so that it doesn't pose other health risks to Canadians and Americans that would include running out of essential goods.
Okay, we're going to go to Lena Deeb and then Ashley Burke.
Yeah, maybe I'll try you again on the same topic, Minister Hajdu. Just talking about health and science and not taking into account the goods. I'm still not clear on why are we still letting Americans come into Canada? We're not talking about truck drivers. I mean, they can get specific permits to drive food trucks. Why are we not shutting the border to all Americans when we see what's going on in the States on the health picture of things?
Well, again, we've advised all Canadians to avoid non-essential travel. Our counterparts are in the process of doing the same kinds of measures around the world. I will say that making sure that we get the right specific details about what are essential workers is critically important. That's work that's happening right now, I know, with Minister Freeland and others around making sure that the policies we put into place together is not going to have an adverse impact on the functioning of either of our countries. Listen, things. And you heard my opening remarks. Canadians are worried about their food supply. This is a real thing and a live thing in North America where we have an integrated economy, integrated supply chains, and where both countries rely on each other to provide essential goods that include foods and other products for our homes, etc., including medications. So it's very important that we do this with a degree of precision and in the spirit of a strong relationship that much of the work that we've done in previous on things like NAFTA has been conducted, and that's the work that we're doing right now. We'll have more to say in the days to come.
Ms. Freeland, when you spoke with the Americans about the possibility of closing the border, did their reaction lead you to make the decision you have made and not a more rigid and quicker decision? Was it the reaction of the Americans which inspired your decision? Answer, no, absolutely not. Our decision is one which was taken by Canadian leaders alongside the Prime Minister. We had a cabinet discussion involving all cabinet members when this decision was taken. The decision was taken to protect the health and safety of Canadians. And for us, for our government, the health and safety of Canadians will always be our top priority. Canada is a sovereign nation. Our decisions are taken by Canadian leaders for Canadian citizens, always.
CBC, and then we're going to take some from the phone.
Minister Hajdu, there's been a lot of talk about that the window is narrow to flatten the curve. How narrow is that window? And as well, does the data suggest that Canada right now is flattening the curve?
Well, thanks. Those are really good questions. And the window is narrow because now we will see an acceleration of cases. We now have community transmission in a number of locations across Canada. And what that simply means is that we cannot actually pin a case to international travel, that we are seeing it spread from community member to community member. And so we are at a critical phase, as Dr. Tam said, because the intent now is to contain the cases as rapidly as possible and to slow that spread. In terms of, so that's how narrow the window. Could you repeat the second question, please?
Does that suggest that Canada's flattening the curve right now?
So it's too early to tell. The answer about the curve and whether or not we're flattening the curve, it's too early to tell. What I can say is that the evidence so far suggests that our early measures have been successful in actually being able to pinpoint where cases are and to not have the widespread transmission that we've seen in other countries that have taken either unorthodox measures or not taken any measures at all. For example, we knew we had cases before we had deaths. In some countries, they knew they had deaths before they knew they had cases. And that is a very bad sign. What that means is you have uncontained transmission and people who have been sick for a long time before they die, allowing for further spread. In our case, because we have had a steady progression of measures based on science and evidence, we've been able so far to be able to contain our spread. But now as we see our cases grow through community transmission, this, as Dr. Tam said, is the critical phase. This is why we're calling on all Canadians to take these extreme social measures, including staying home, including working from home, including the cancellation of events. Later, Dr. Tam will make an announcement that we're now asking people to consider canceling events that are larger in size than 50 people, because the time is so critical. And so I would urge all Canadians to do what you can to be part of flattening the curve.
There are a lot of Canadians right now that are abroad trying to get home. They're trying to follow the government's advice and book flights. Some of them have to wait days, and there's a fear out there that they're going to be stuck in another country. That country's border could close down. And as Minister Champagne's been saying, there won't be repatriating Canadians from around the world. Are you talking to airlines to try to make sure they're still flying, getting extra flights there? What is being done to make sure Canadians are not stuck abroad?
Thank you. So we are conscious of the fact that some people people, our Canadians, are abroad and are having difficulty returning and will have greater difficulty as a result of the measures that we have announced today. So we are talking with the airlines, but in addition about the possibilities to bring people home. It's the very early stages at this point, but also I would say that we are also putting in measures, funded additional consular support and partnerships with on the medical side, so that if there are Canadians that are abroad that could not come home because they were symptomatic and have to attend to their medical needs, that there will be some assistance there from the consular point of view and financial assistance, and that if they have to stay outside the country for a period of time unplanned because they wanted to come home, that there will be a fund to provide some financial assistance to those Canadians.
We're going to take one more from the floor, and then we're going to go to Marika Walsh for the Globe and Mail.
Hi there. I'd like to get some more information about what the coordination is between the provinces and the federal government. Canadians across the country are getting very different information. I understand different jurisdictions. I understand different caseloads and all of those things. But the Prime Minister said today there is an aligned response, and we're not seeing it. So why isn't Ottawa giving a baseline minimum response that everybody needs to take, and then provinces can increase measures where it's necessary, for example?
Okay, I'm going to maybe ask Minister Hajdu to talk about the very close coordination that is happening on the public health side, and then maybe I'll make a couple comments about cooperation with provinces in general.
Well, thank you for the question, and I will say that that's exactly what's been happening since the very early days when we first noticed that cluster of cases in Wuhan. Dr. Tam convened what's called the special committee that pulls together public health officers from all across the provinces and territories with the federal government to begin that close coordination to prepare for what could and what did eventually become a pandemic. So that coordination is happening, and there are baseline guidance provisions at all different levels, at technical guiding levels for hospitals and for practitioners, a variety of other kind of considerations, including procurement professionals that are working across jurisdictions to make sure we have a scope of the knowledge about what's needed, where the gaps are. That work has been going on since very early January. Of course, we have also provincial and federal jurisdictions in terms of the types of measures that we can take and our own distinct responsibilities. And so the work that Dr. Tam is doing is to try to coordinate a response, but also to recognize that provinces and territories have the jurisdiction to act in a number of ways that is independent of the federal government.
And if I could just add that, we very much recognize, as Minister Hajdu has just said, that there are specific conditions in specific cities, specific provinces. That's why we have public health officers also at the provincial and the city level. And those public health officers are all behaving in, I would say, a very admirable, proactive, and energetic fashion. As Minister Hajdu said, there is very good national coordination of all of the public health officers. And at the political level, on Friday, we had a call chaired by the Prime Minister of all of the First Ministers. Since then, over the weekend, I spoke with a bunch of premiers directly. So did the Prime Minister. We plan to now have regular calls at the First Minister's level to coordinate our national response. That's going to be very important. And then just finally, it is so important, given that this is first and foremost a question of protecting the health and safety of Canadians, to be very clear with all Canadians that the federal government absolutely acknowledges the need for federal leadership. We are not going to quibble about federal provincial responsibilities here. The federal government will be there to be sure the Canadian healthcare system across the country has the resources to deal with this situation, whether it comes to our national bulk procurement efforts or the commitment that we have made to provide financial support to the healthcare system.
Okay, operator, take a question from the line.
Thank you. Once again, please press star 1 on your telephone keypad if you have a question. N'hésitez pas à appuyer sur étoile 1 pour toute question. The first question, la première question is from Hélène Buzetti from Le Devoir, de Hélène Buzetti du Devoir. Please go ahead. Your line is open. À vous la parole.
Oui, bonjour. Ma première question est pour Monsieur Garneau.
Thank you. My first question is for Mr. Garneau. You acknowledged today that by limiting foreign flights, there will be fewer flights than previously. This will make it harder for Canadians who want to come home. So can you repeat whether Canada is willing to repatriate its citizens abroad? If they have trouble finding a flight, what kind of financial aid will you give these Canadians? Will there be a cap of $5,000, for instance? Well, as it now stands, we have not excluded various options, but we have begun discussions with airlines to see whether we could bring about a plan to repatriate certain Canadians who just cannot come home, or because there might be a delay for them, or because they might be presenting symptoms of COVID-19. So we're looking at all of those scenarios right now, and we're just at the beginning of that process in our discussions with the airlines. However, at the same time, we are recognizing that there will be a need for enhanced consular services. So we are going to send more financing to our consulates, and we recognize that some people will have to stay abroad for longer because they are either getting over COVID-19 or they are in the 14-day isolation period. So we would help these Canadians with financial support. We have not set a threshold, but we have set up a fund, and we will have more information in the coming days. My other question is for Ms. Freeland. You said that only Canadian citizens and permanent residents can come home again, and perhaps a few others. But there's a question for people who have a work permit or a study permit, study visa or work visa, people who don't have a status in Canada but who live here and who may have just gone abroad on a short trip. Will they be able to come back to Canada? People who have the right to return to Canada are Canadian citizens, permanent residents, direct family members of these two groups, and we will make some exceptions for essential personnel. Minister Garneau has already referred to pilots and flight crew. I'm sorry, I'm talking about people who have a worker-student visa. So people who would also be included in that group are people performing essential services, including diplomats. What about study visas, people who have study visas? Well, exceptions are for people who are carrying out essential duties. This could include essential studies. The next question is from Manon Cornelier of Le Devoir. My first question, or rather, I don't think you clearly answered my colleague's question on work and study visas. If you could clarify that for me, that would be good. I do not understand why there's talk of avoiding food and medication shortages, and this is the reason why Americans will still be allowed to enter Canada. Why can we not state that American tourists will not be allowed into the country while keeping our supply lines open, and this would not prevent essential workers from crossing the border? So why will American tourists still be able to enter Canada? Now, with regard to our border with the United States, a few things. First, we have already stated, as Minister Blair pointed out, that persons coming into Canada from abroad, including from the United States, will have to self-isolate for 14 days. This is a strong measure. This is a measure which applies to everyone, whether they are Canadian or American. whether they are crossing a land border or flying in. That is a significant measure. Second, as Minister Hajdu said, and as Dr. Tam said over the weekend, it is recommended that all Canadians not to engage in non-essential travel abroad. This is also a strong measure. With regard to other potential measures at the border, well, I believe that all Canadians understand that we share a very special border with the United States. It is our only land border, and it is an essential border for the economic life and for the social life, as Minister Hajdu said, for Canadians, and for the supply of food in Canada. So, all we are doing along our shared border with the United States must be very specific. We are taking very specific, detailed measures, and we are working with business leaders, with unions, with the provinces, and with our American partners. So we are doing that work, and this is a situation which we are monitoring closely hour by hour to see if there are any changes, but I believe that Canadians understand that with regard to this border, we must take measures, or rather, we must make sure that anything we do will not create problems in our country, including health problems. Perhaps Minister Duclos would like to add a few words. You have well summarized the situation, Minister Freeland. That said, I would simply like to point out that over the last few days, the situation has been evolving very quickly with regard to airlines and the border. Just a few days ago, Canadians were invited to avoid all non-essential travel abroad. On Saturday, Minister Champagne invited Canadians to quickly come home again, given that the availability of commercial air flights was shrinking, and yet yesterday, it was clearly stated that all travelers entering Canada, be they Canadian or foreign nationals, would have to self-isolate for 14 days. And this led Minister Blair to implement measures in all airports. As he indicated earlier, he has added an additional question for returning travelers. They must acknowledge that they realize they must self-isolate for 14 days. So any traveler coming in through an airport, anywhere in particular at Dorval since last evening, must indicate that they have clearly understood their obligation to self-isolate for 14 days. I say this because Mr. Garneau and myself have spoken with Ms. Plante, the mayor of Montreal, over the last few hours. We have told her of this situation, this measure which we brought about yesterday. She was very happy at that decision, and I think things are much clearer for everyone now. Mr. Garneau would like to add a few words. With regard to the issues raised by Ms. Buzetsi and Cornelier, with regard to persons here on student visas, in our approach, we have focused on essential workers, but you have raised an important issue, and we will come back to you on that issue.
Okay, I'm told, unfortunately, that brings our news conference to an end. Apologies to those on the list who did not.
The question was inaudible.
Respond to that.
Well, I'll speak from the health minister's perspective. I've been working very closely with Minister Dix in BC to talk about an approach that actually reaches our goal of obviously reducing cases and infection in Canada, while also, as I mentioned earlier, maintaining our supply chain. And I know that Minister Freeland has been engaging with Premier Horgan as well on the very same issue. As I said earlier, this is a complicated situation. Obviously, we are working very closely with the United States on ways that we can protect our citizens on both sides of the border, but that also keeps the integrity of our supply chain intact. Obviously, for BC, it is important that they have access to the U.S. market for a number of essential goods, including food, and the same can be said for the United States for many of the things that Canada produces. So we're going to continue those conversations with the Americans this week, and we will have more to say in the days to come. Thank you.
Yeah, I'd like to add on BC, if I may. Hang on. If I could just add on BC, as Minister Hajdu said, we are in very close contact with the BC authorities. Minister Hajdu is working very closely with Minister Dix. I spoke at length with Premier Horgan over the weekend, working with Minister Garneau. We made some changes, for example, to the treatment of passengers on BC ferries to help with social distancing. We are very aware of the situation in BC, where they are facing a significant outbreak situation. They are next door to Washington State. Premier Horgan has a very good relationship with the governor of Washington State, and they are also in constant contact. At the same time, as Minister Hajdu said, BC, like every single province and territory in Canada, has extremely close, extremely dense social and economic connections, human connections with the United States. We need to, in taking actions on that border, act with real care, with real delicacy, and with real precision. The fact that we are saying to all visitors to Canada and all returning Canadians that they are strongly recommended to go into 14-day self-isolation means, self-isolation for 14 days in Canada, that I don't consider to be something that a tourist would like to do for a holiday. This is serious for everyone traveling to our country, and we are advising Canadians only to undertake essential travel outside the country. We are very carefully reviewing the situation at our shared border with the United States in close collaboration with our American partners. We are saying to Canadians, let's take measures here to protect ourselves and protect our neighbors. That applies to the people who live next door to us, and the Americans live next door to us. So we are working closely on this, but I want to emphasize to Canadians, and I think Canadians understand this very well, it is a dense and close relationship, and measures that we take there will be carefully thought through. It is important for us to be mindful of the really close connections. For example, as Minister Hajdu has said.
This is the Minister of the Deputy Prime Minister, Chrystia Freeland, discussing the tight links between Canada and the U.S. and the decision to close the border. We're going to leave our viewers on CBC. You can continue watching on CBC News Network.
Canada. So we need to act with great care and deliberation, and we will also act with alacrity.
Okay.
Merci. On sera ici demain.
We will see you again tomorrow.
I'm Rosemary Barton. You have just finished watching a briefing by a number of cabinet ministers after some significant news from the Prime Minister earlier today. Canada has decided to limit entry of anyone into this country except for Canadian citizens, permanent residents, and U.S. citizens. That decision in an attempt to try and contain the COVID-19 virus, which continues to spread. And you heard just there at the end of the press conference from both the Health Minister and the Deputy Deputy Prime Minister about the spread of those cases in British Columbia in particular. BC confirming not long ago that there have been 3 more deaths in North Vancouver, all related to that same long-term care facility, Lynn Valley Care Centre in Northern Vancouver, which brings the total number of deaths in this country to 4. All of them, again, related to that elderly care centre. Dr. Bonnie Henry, the Provincial Public Health Officer, spoke just moments ago from Victoria. Let me show you some of that.
The sad news is that we've had 3 additional deaths that have been reported over the last few days, and all of them have been residents in the Lynn Valley Care Centre, where we know we've been dealing with an outbreak for the last week and a bit. We also just want to note that we have increased cases in both Vancouver Coastal Fraser Health, as well as new cases here on Vancouver Island and in Interior Health in the 30 cases that we've reported here.
So that is Dr. Bonnie Henry in British Columbia. I'll bring in my colleagues in just a moment. She also pointed out, and this may just be important for people listening at home, that there was a dental conference that was held in Vancouver that had 15,000 attendees. And Dr. Henry says that if you were at that conference, it is urgent that you self-isolate. Attendees were not just from British Columbia, but from across the country. Again, if you were at this dental conference that was held in Vancouver recently, 15,000 people there, they are urging you to self-isolate as well. British Columbia also canceling elective surgeries to make sure their hospitals have capacity for the increasing number of cases of COVID-19. And they say there will be a decision on BC school closures tomorrow. All right, let's bring in the host of Power and Politics, Vashi Kapellas, and the CBC's David Cochran to go over a little bit of what we heard from that lengthy press conference with cabinet ministers. I have to say that I'm getting a lot of questions on Twitter, people trying to clarify where things are. So the best the 3 of us can do at trying to make it really, really clear, let's do that, because I also was a little bit confused around some of it, to be honest. So I'm going to start with the point that was confusing me, but I think I have now. So obviously the border is closed to everyone except Canadian citizens, permanent residents, and U.S. citizens. But there are caveats to that as well, Vashi.
Yeah, the caveat is basically if you come across the border and enter Canada, if you fall into any of those categories, even if you are allowed to cross over, that you are to self-isolate. And this stems from a lot of the questions that we were asking right out of the Prime Minister's press conference, and then the ministers received from reporters there. And they mostly focused on, okay, what is with this exemption for U.S. citizens? Why, if there are concerns about the spread of the virus south of the border, why are we still letting U.S. citizens across the border? And a number of the responses seem to indicate that they hope the fact that people would have to self-isolate for 14 days after coming across the border, they hope that that would send the message that they shouldn't come, essentially. But they're not going so far as to say so. They talked about the integration between our 2 economies, which we know to be a very real thing. They talked about the sort of dependence of our economy on exporting there as well. Again, pointing to that sort of idea of integration. But they also said that this was evolving and that they would keep considering, that didn't seem to be a forever kind of thing. We talked a little bit earlier about some of the different sort of calculations when it comes to that border, be they political, be they economic. Clearly, those are all part of this right now, but they are still getting a lot of questions about why the border between the U.S. and Canada remains open, even if they're saying that, self-isolation will dissuade people. I saw Adrian Dix, the health minister in BC, for example, during that update that you referred to, specifically said, we don't want anyone from the U.S. coming to BC. If you're thinking of visiting, don't. And he was pretty explicit about it. So I imagine that there's some pressure, for example, from BC, which Chrystia Freeland referred to, but there is some pressure from BC, and I know from Ontario, to do more when it comes to that border.
Yeah, and I would imagine when you are dealing with an administration that is unpredictable, to say the least, to do something that could be provocative, or, you probably have, it's not just the economics, is my point, is if you shut it all down, you have to think about what the response might be. Obviously, they're making decisions that are first and foremost about health, and secondly, about the economy, but I'm sure that's in the back of their mind. Okay, Vashi, thank you so much for all your help. I know you have continuing coverage tonight on Power and Politics. David, you'll be talking throughout the day as well, but I got to let you go now as well, because we are going to take you at this hour back to the National Press Theatre, where Canada's Chief Public Health Officer, Dr. Teresa Tam, is standing by to give a public health update. I'm Rosemary Barton. Andrew Nichols will take over just after this. Thank you for watching CBC News Network.
COVID-19 is a serious public health threat. This disease and this outbreak will disrupt our lives. For many of us, that may mean we are ill or our family members are ill, or that work, social functions, childcare, and other aspects of our lives are disrupted. But for some, the disease will be much worse, severe, and life-threatening. We all need to take every precaution to protect older adults and medically vulnerable people who are at greatest risk of severe COVID-19 disease. Those of us within Canada are urged to postpone or cancel travel outside of Canada unless it's essential. To increase your personal physical space from others, public gatherings of 50 people or more is to be avoided. Where flexible work arrangements are possible, consider contingencies like working from home if this becomes necessary. And most importantly, if you do develop symptoms, no matter how mild, stay home and follow the instructions of your local health authorities. Doing this will keep protecting others around you and very likely save a life by limiting the spread of this disease. Again, this is our chance right here, right now, and we need to act now and act together. Thank you.
Merci et bonjour à tous. Dans le monde, il y a actuellement plus de 175 000 cas de COVID-19 dans plus que 160 pays. L'augmentation des cas signalés au Canada pendant les quelques derniers jours demeure inquiétante. À l'heure actuelle, il y a au Canada 407 cas de COVID-19. À ce stade, toutes les provinces, 10 provinces ont fait état des cas.
Over every province. There are 8 confirmed cases and passengers repatriated from the Grand Princess cruise ship. They are all in quarantine at CFB Trenton. So far, Canada has tested 34,000 people around the world. Europe has now become the epicenter of the outbreak. We ask that all travelers arriving from outside of Canada to place themselves into a 14-day self-isolation period, and this fact will help to slow the spread and the transmission of COVID-19 in Canada. However, the movement of goods and essential workers will be an important factor in Canada's fight against COVID-19. Therefore, essential workers and any conveyance will be exempted from the 14-day self-isolation period. All Canadians must act now and here and take every possible precaution, including social distancing measures, to stop the transmission chain and to slow down the epidemic and to flatten the curve of COVID-19. Declared cases in Canada, for the most part, are connected to travel. Public health officials across Canada are therefore continuously deploying important efforts to screen passengers, to find cases, and to isolate confirmed cases. COVID-19 is a serious threat to public health. The outbreak of this illness will disrupt our lives for many of us. The consequences will be illness or the illness of a loved one. Further, the social aspect of our lives, childcare, and other aspects will be disrupted as well. For some people, the illness will be quite serious, and it might even be life-threatening for some people. So we must all take every precaution to help protect seniors and vulnerable people because they are particularly exposed to the risk of developing serious consequences if they get COVID-19. So we are calling on all Canadians to cancel or delay any non-essential travel outside the country in order to increase the physical distance between persons, avoid public gatherings of 50 people or more. In cases where it is possible to bring about workplace flexibility, we encourage the use of telework. Lastly, and we insist on this point, it is particularly important. If you develop symptoms, even if they are light, please stay home and follow the instructions of local public health authorities. In doing so, you will protect the people around you, and you probably will save at least one life, and you will help to contain the spread of this illness. In Canada, it is still possible to act quickly, and we must do so together now. Thank you very much.
CTV.
For Dr. Tam, the Prime Minister said that he's been following public health advice when he's making key decisions. Do you agree with the government's decision today to still allow U.S. citizens to come into Canada, even though we see the spread in the U.S. there?
Well, I think from my perspective, the most important public health actions must be to show up a domestic response, to detect cases, to do contact tracing, and to do social distancing. Those are the key things that's going to be really, really important right now. Border measures add layers of protection on top of that fundamental public health action. So border measures are never perfect, and you have to weigh all the pros and cons of doing them. I do think that putting the measure of asking people to self-isolate when they arrive in Canada is a really important aspect of the public health response, which means anyone who might be infected are asked to self-isolate to prevent the onward transmission and the impact on those who are vulnerable in Canada. So that's the concept.
And now that we're going to see an influx of people coming back into Canada, do we have enough tests to make sure that we can tell who's positive and who's not? And do we have enough protective equipment for doctors so that clinics don't have to close?
So we're working really closely with partners and territories, and one of the key aspects of our collaboration is to determine the needs of all of those supplies and to be able to pull together mechanisms for bulk purchasing and other means. So we are actually looking at any other possible avenue in order to get those supplies. That doesn't mean that one should not be prudent with the actual testing strategies. So those must be carefully managed in order to home in or focus on the population who are most likely to be infected. That's for sure. But we are absolutely working together to get those supplies that the health system needs.
Okay, we're going to go to Kelsey Johnson, Reuters, and then Philip Vincent Boissy.
Dr. Tam, BC Health Minister Adrian Dix has said that they remain concerned that visitors from the United States are continuing to be allowed into Canada. Their strong message is that visitors from the United States do not come to British Columbia, don't come. Do you agree with that message from BC?
Well, I think British Columbia shares a border, of course, with some key areas of the United States experiencing cases of COVID-19. So it is important to work together to reduce that risk. I think that, again, asking people to self-isolate when they come into Canada is a key move. Together with Dr. Bonnie Henry, we discussed the need to actually maintain essential supplies and those essential services officers, there are also potentially workers who are maintaining some critical functions that do work across those borders. So we're working together to make sure that we know how to exempt those people who will be still asked to stringently self-monitor and to make sure that they self-isolate on the detection of symptoms.
And also earlier today, the Prime Minister, in the Prime Minister's remarks, he asked Canadians to stay home. Do we know how long Canadians are going to be told to stay home? This is outside of those who are obviously being asked to self-isolate, but the advice, at least in the City of Ottawa, is do not go outside unless it's for essentials. Do we have any idea about how long that period of staying home is going to be?
So right now, I do believe we are in a fairly critical period. We saw the numbers in Canada go up quite a bit over the last several days, so certainly over the weekend. So I think all local public health officers and provincial public health officers really feel that the time is now to increase that social distancing. So you're hearing those messages all across Canada as to how one might do that. For sure, you need to listen to your local public health, because the activities for COVID-19 and the construct of your community, your density, etc., are actually quite different across Canada. You have smaller jurisdictions, smaller communities. So you actually have to look at your particular context. Here, of course, we have to listen to what Ottawa Public Health has to say as well in order to look at our individual situations. But I think the message really is about social distancing and how to do that, but without actually socially isolating people as well. You need to look in on your neighbors and figure out how you maintain those sort of connectivity and support each other.
Philippe Vincent,
Monsieur New en français. J'aimerais vous entendre sur...
Mr. New in French, please. I would like to hear you on the numbers. The government of Quebec said that under the worst-case scenario, there would be 24,000 deaths in Quebec. There are already 4 in BC. In a Canadian scenario, how many potential deaths could there be, and how long will it take to hit that number? Days, months, or years? Well, the current situation is still extremely fluid. I respect what the government of Quebec has projected with regard to potential deaths. We are still working closely with each province and territory. At this point here, I cannot give you an exact number. However, this is part of our planning. We want to make sure we have the resources we need in hospitals in case there is the contagion spread. Despite the 4 deaths in British Columbia, most cases in Canada are isolated. People are at home and not really that ill, not in hospital. So up until now, we have been lucky, but we cannot take this for granted, and we are still planning for every type of scenario. With regard to the border, it's been 2 weeks that you've been saying that it's not working at the border measures are not effective. Science shows that shutting down a border is not effective. But today the border is being closed to almost everyone but to Americans. Has the science changed, or has politics won out? No, science has not changed. We have repeated that the virus travels across borders, and these are extraordinary times. So now is the time, not only for all orders of government, not only for the healthcare system, now is the time for all Canadians to engage in social distancing, and that is what we all need to do now, social distancing. We are telling people to avoid gatherings of 50 people or more. So the border is another issue. And at the border, we also want to bring about social distancing. All passengers arriving into Canada at only 4 international airports, all Canadian passengers, Americans, anyone, will be strongly encouraged to self-isolate for 14 days. So this plays into social distancing as well.
And then Dylan Robertson.
Dr. Tam, I'm just wondering, because we were talking last week about not needing these restrictive measures at airports, not needing to close our borders to the outside world. I know you said that the science has changed. Can you tell us how the science changed over the weekend to make that an appropriate measure?
Well, I think right now what we're seeing is that sort of upward ticking of the curve, of that epidemic curve, which with a number of increases in cases over the weekend as well. So that the day-over-day increase tells us something. While of course, it's a bit early, now is the time to see if we can sort of level that off and as fast as possible. So for me, it's interesting how that curve may change in the upcoming days, and certainly we'll be watching it very carefully in the next 2 weeks. So we just enacted and beginning, I think, across the country to have a concerted effort in these social distancing measures. The border measures is but just one additional layer. I think given that many of our cases are essentially travelers and the number of countries around the world that are having COVID-19 is continuing to increase to over 160 now, that's just another layer, I think, that the government has decided to enact in order to add to the protection of Canadians.
I guess sort of on that, does that jump from 100, I think it was about 170 cases on Thursday to now over 400? Does that really concern you that they've, more than doubled in just a few days?
Well, I think that's one of the reasons why you're seeing such a strong message from all public health officials from all levels of government. But you do have to unpack that increase and figure out, well, what is that increase due to? If it's still due to mostly travelers coming in, you know that some of your response must be targeted towards the reduction of the introduction of the cases. So many of the last set of cases are still travelers or their close contacts. What we're trying to work out, and public health officials continue to do so, is that are there any community transmission? So even with increased cases, you're not as concerned unless there's some ongoing community transmission. You're also less concerned if it's the less vulnerable groups. Now, if you introduce this virus into certain settings, such as places where older individuals live, you're going to get a higher impact. So you have to pull out all stops. No matter what the numbers look like, is exactly what the numbers underneath tell you. And if the people impacted are in high vulnerable groups, now is the time to absolutely try and protect them through social distancing and other measures.
Okay, we're going to Dylan Robertson, Winnipeg Free Press, and then Tessa Sanchi.
Dr. Tam, just on the note about vulnerable communities, I wanted to talk a bit about First Nations. We've had some of the Northern Manitoba chiefs say that their nurses don't have adequate information or supplies. We had that one presumptive case in Northern Saskatchewan. I'm just wondering how confident you are with Indigenous Services handling of this, and if there's any oversight of what that department does by you or any of your colleagues.
Well, what we do is we include their medical and technical advisors in the Special Advisory Committee. So we have been sharing information and technical guidance. I think what is needed, and of course First Nations communities, Métis populations, as well as Inuit communities, all have to collaborate with the local jurisdiction as well. So that's really, really important. And I think part of it is actually translating what we developed into the context of those communities, the realities, well, what does social distancing actually mean in a very different context. And so I think that's the kind of work that's underway right now, and we need to really accelerate it. So I think that nothing that we do is ever too much. We need to have more engagement and ensure that the needs of those communities are met.
And Dr. Tam, correct me if I'm wrong, but why are you not advising the government to order a closure of non-essential business across Canada? This is what the Quebec government's doing. Is there not evidence for that sort of measure?
So again, we collaborate with all the chief medical officers, and our role is provide guidance. How you implement and execute those guidance is, of course, up to individual municipalities or provinces, depending on the context as well. And so I think that is partly what you're seeing. You have to make some of the decisions on a local level. But for example, we did come to a consensus that mass gatherings or gatherings of over 50 people should really avoid, postpone at this juncture, because right now is a very important period of time.
Okay, we've got Tessa Sanchi, Hill Times.
Hi, so my question follows up on some previous questions about supplies. Are there concerns about any shortages of particular supplies at this point, items that you're especially looking for right now?
Well, I think this is a sort of ongoing, everyday kind of discussion. But the kind of supply, as you can imagine, that we are all interested in getting more of are personal protective equipment, but also laboratory supplies. So I would say those are the two really key things. We also are discussing purchases of ventilators, for example, should jurisdictions need them. I don't think there's shortages of them necessarily. It's just that that's some of the supplies that people have been interested in.
Follow up specifically about the testing kits. Prime Minister Trudeau mentioned over the weekend that one of the reasons he was not tested was, in addition to being asymptomatic, it would take a testing kit away from someone who was symptomatic. So is there a particular concern about shortages of testing kits, and how difficult is it to get an increased supply? Obviously, our numbers are growing exponentially.
Yeah, so I think you will see that there'll be every effort to ensure that we have enough supply, but you also really need to be smart about who you're testing. So you're seeing different jurisdictions making sure that you're not potentially targeting the test kit to people who are likely not to have coronavirus, but instead has some sort of other upper respiratory infection. So I think every jurisdiction is looking at exactly how they manage that supply. Having said that, there's quite a lot of innovation in thinking in this field. For example, certain viral swabs might be in shorter supply. So laboratories are actually testing other swabs that are in plentiful supply, and how do we use those instead? So lots of that kind of innovation is happening. Another area of very worthy of monitoring is the fact that there are now new commercial kits becoming available from different manufacturers. So Health Canada is helping to really review those really rapidly, so that you have good quality testing kits that are more of the commercial variety. You don't need a provincial lab or a high-level sort of hospital lab with a PCR machine in order to try and get those tests done. You're going to see more and more of that kind of availability. But I think our role at the federal level is both the regulatory, making sure we get fast tracking and monitoring all availabilities, and then help coordinate that supply.
Okay, we're going to take two more in the room. Todd Ledrande from APTN, please.
Yes. I've heard reports that there's a handful of First Nations that are already are self-isolating, so they're closing off their border, so to speak, and other First Nations are considering this. How effective a strategy is this at this point, especially for remote, maybe fly-in communities to maybe consider doing this?
Well, I think that's a very important question, because really you cannot afford to have the virus enter an area that has less ability to cope with it. So I think leadership, Indigenous leaders, First Nations leaders in their respective community is discussing with public health and others to see what is appropriate. And I think for that particular community, the ability to tolerate that kind of risk is such that I think many are thinking, well, we just can't afford to let the virus enter. So as a result, many might be taking those kind of decisions, but it is an individual community decision as well.
If the virus were to get into one of these First Nations, they are vulnerable. They don't have the capacity. They may have a nursing station. Somebody gets sick, they have to medevac somebody all the way down to Winnipeg or Edmonton or something like that. So is there any plans to perhaps tag the military to come in with a field hospital, construct a field hospital, bring their expertise to a remote region like that?
Well, I do think that right now all kinds of solutions are on the table. I do know that territories as well as provinces are connecting so that those medical transportation linkages are maintained and the specific needs of northern or other remote community or flying communities are addressed. So that's part of the active planning going on right now. But if there's a certain need for some surge capacity, some of those things can absolutely be considered.
Mike Anthony, Global News. Mike, do you have a question?
Well, no, not anymore.
Okay, thank you. Okay, we have to go.
We have a lot of questions still.
Yeah, operator, do we have any questions on the line? Okay, Marika?
Yeah, I'd like to, Marika Walsh with the Globe and Mail. Could you explain if you, sorry, I just want to make sure I have the correct question for you. Here's a question about the response that we're seeing across Canada. Mm-hmm. Would a uniform response from all provinces help reduce the spread and the risk? Would that be better than what we're seeing now?
Well, actually, Canada is a very vast country with very different contexts, and the activity of the virus is different in different communities. So while we provide national guidance, there is actually a need to have a look at what the local and the provincial contexts are. I know that many years of pandemic planning, for example, influenza in and of itself, for example, we cannot determine that it's going to be the same activity everywhere at the same time. This is, however, a time for absolute concerted action from every jurisdiction, I think, at the same time. How you exactly do social distancing and how you manage workplaces, schools, etc., is left to the individual jurisdictions. But I think there's a strong collaboration in some of the guidance, some of those thresholds, as I said, that's just been discussed today for mass gatherings, for example.
Okay. Do you have a follow-up?
I don't want to take up other people's
Ashley,
time. So,
Ashley Burke, CBC.
Hi, Dr. Tim. I'm hoping you can talk about the curve, and you've mentioned there is a very narrow window to flatten the curve. Can you be specific about timing? Are we talking about a matter of days? And as well, how is Canada doing to flatten the curve? What does the data show right now?
So what you just asked is actually quite an important question. You can't precisely say the exact time, except that very careful monitoring for the next 2 weeks, I think, is very critical. We are beginning to implement all of those social distancing measures. You're seeing different communities beginning to do that kind of measure. Is the type of action that is applied to that curve. So you might not even see how far this curve goes if you manage to actually put all these measures in place to try and reduce it. So for me, is really much more interesting to see how that curve may change over time, as opposed to predetermining where it's actually going. What you want to do is, you can do scenarios, you can do X% rate of increase, but that's actually not the real time, sort of situation. So when you see the rise in the curve, what I'm trying to say is now the goal is to see how much we can level it off and don't let it take off.
Well, right now, where is Canada? Like, how are we doing in flattening the curve?
We're at the very beginning of, I think, the increase in the illnesses, and they're still mainly tied to travel and contacts. What I'm really watching out for is signs of bigger clusters, outbreaks, community transmission, and we're not really seeing a lot of that at the moment. Now is the time to actually really interrupt those chains of transmission.
Okay, we're up against the clock. I've got 2 more people on my list, so if we can just keep it to 1 question each, that'd be Helen Bazzetti and Rachel.
Very briefly, you said that most cases are linked to travel. Can you tell us how many cases are due to community transition, and how many cases do we have from travelers coming in from the United States? Well, I don't have those exact figures right now, but we did do some calculations previously. About 87% or just under 90% of cases are linked to travel. So travelers coming back to Canada or people close to them. About 13% are due to community transmission. As far as cases coming in from the United States, the situation is fluid. Almost all provinces have reported new cases every day. We are doing the math. In the last few days, in the last few weeks, there are more cases from countries in Europe and from the U.S. At the very beginning, most of the cases came from China and Iran, but now it's countries which include the United States.
Doctor, I just have a quick follow-up for one of my questions from before, unless anyone else did have one more.
I had a question.
So I'm happy to share.
Okay, just rapidement, l'interdiction.
Very briefly, the social distancing, is that possible? Would it apply within an aircraft? So when people, would that apply to flights within Canada? Well, not at the moment. We're specifically talking about public spaces because people can mix and mingle. On an aircraft, there are seats, people don't move. And there might be a couple of people sitting around you on a flight. But contact might be easier in the community. We are following that. But up until now, even with the cases in Canada, we have followed up on people on those aircraft with passengers, so there does not seem to be transmission within an aircraft. There is more transmission in the community, and the risks are higher in the community than on an aircraft.
Further question about when I asked you if you agreed with the government's decisions to still let U.S. citizens in. In your answer, you said that there are pros and cons to this decision. Can you please tell us what are these pros and cons to this?
So I think in terms of some of the measures that we're putting in right now, and you're going to see, I think, much more visibility at the points of entry, is the idea of self-isolation, as I've said. Certainly, in some ways, that acts as a bit of a deterrent. So if you were a non-essential traveler, and you know that that is the request for you to sort of come here and then self-isolate for 2 weeks, that acts as an approach where it's very likely to sort of reduce the number of travelers even in and of itself. But we must maintain that sort of essential bridge between the two countries, because we dependent on each other, even on the response where you have certain supplies and maybe workers even, and critical infrastructure workers. So I think that's really important. We also do have very close communication with the United States. What we will want to see is that they've enacted certain measures also to try and contain their epidemic as well. And so we need to just evaluate the situation every day and see if these measures are effective, and if not, we'll evaluate them.
Can I just sneak in one more? I know things are tight, but just for my health colleagues, the question is for you, Dr. Tam, on who should be getting tested, because we're seeing different rules across the provinces. So from the federal government, from you as the Chief Medical Health Officer, who should be getting tested right now?
So right now, travelers, essentially, who have symptoms. And in addition, anyone with severe respiratory illness, like pneumonia or severe acute respiratory illness in the hospital, regardless of whether they've traveled. We're also recommending long-term care facility, influenza-like illness or COVID-like symptoms, or clusters or outbreaks. Very important to test those kind of settings, any kind of hospital-related illness like that. Healthcare workers, healthcare workers who are sick. You do not want healthcare workers to be going into any facility that might increase infection to those most vulnerable. So they are also absolutely a priority. What we are trying to be very careful with is all the people who might be just very worried ill, who may have some mild symptoms, who don't have a history of travel. But if you're still concerned, what we're saying is that the clinicians should have the ability to make their own clinical judgment. This is how medicine works in Canada. And that ability of the clinician usually is the astute clinician who've spotted our initial cases from countries that haven't been reported. So you cannot reduce their ability to be flexible in their own judgment.
Thank you very much.
Giving us an update on the latest numbers and the reactions to some of the measures that have been implemented. You heard from Dr. Tam there saying that there has been an uptick, a significant upward ticking of the curve of the number of coronavirus cases in this country. It now stands at 400.